Don't worry, I've got this.
I'm the king of the squirrels and king of the acorns. This is something you need to understand, baby. You can't play with the king, because when you play with the king, sometimes you might have to sing. Cha-ching, you understand me, baby? Now watch this.
Horseback Quagmire 69 says, "Yo bro, you ready?"
Hey, you want to know a secret? Watch the stream and you'll find some stuff out.
Jeez, guys. You really need to watch the stream so I can avoid places like this. If you guys keep watching, subbing, and supporting this stream, I won't ever have to put the fries in the bag.
I'm here from the Grubus Police Department. Here to investigate why you're not watching the stream more often. You have to make sure you have notifications and all that enabled. Otherwise, I'll get you for the crime of not watching the stream. See you up there!
Let's make this quick. Wish me luck.
As I've floated around here, I've had a lot of time to think. Think about this, think about that. I've thought just about every thought there is to think. You know what's the one thought that always sticks with me? Grubass is the best streamer I've ever seen. That makes me happy.
As a professional safari guy who's been doing big-time safari things for a long, long time, mate, there's one very, very important thing I've learned. Watching the stream is one of the best decisions you can make.
Up now. I'm the sewer man. I've got the sewer plan. This is what I do day in and day out. Sewer, sewer, sewer. If you want to avoid being like me, a typical sewer guy, what you need to do is watch Gruber's stream, which it looks like you're already doing. All right, let me get back to sewering.
Hey there, you've been sleeping for a while now. That's all right. We're almost there. Oh, you forgot? Man, you really were out. We're on the way to the stream.
What up, chat? What up? How's everybody going? How's it doing? What's doing, everybody? You know what I'm saying? Come on. Another beautiful day today. Here's the plan, right? First part of the stream, I want to do some research into peptides.
Says, "Yo, where you at, man? Been sitting
Where
here
am I at? I'm right here. I'm right here for you, dog. Come on. You know what it is. So, here's the plan for the stream. Gonna start off, we're gonna do some research into peptides. Because I'm very much interested in fucking peptides and possibly taking some, maybe some of that SEMA or that Selvac or whatever the hell it's called. It was that Russian shit they got that was like invented in the 90s. But that's what we're going to do. That's what we're going to do. So I got some videos lined up here. We're going to do some research online, see what's up. I might place an order for some right now, you know. We'll fucking find out. I've already been taking Ozempic, so I'm familiar with the peptides already. And it fucking works very well, because it made me lose a lot of weight. So, might as well make a stack, right, boys? You know what I'm saying? A little peptide stack action? How about it? Let's fucking check it out, though. Let's look into this. Let's see what we can find. So I got this guy lined up first. I was watching a couple of his videos before, and he seems to know what he's talking about. He looks fit and in shape, you know. So he's definitely fucking with the peptides. Supposedly he's a doctor.
Says, Sheesh, gonna make me sit
Gonna
through
make you
class,
sit through a
SMH.
class? Yeah, a little something like that. Something like that. You know, with some of my commentary mixed in. You know, a little bit of a different kind of stream going on. So let's see. Let's see. So this video of him breaking down the peptide craze, right? Or no, fuck that. Let's watch this guy. Look, this is the kind of guy you want to take advice from when you're talking fucking peptides and body enhancement. Look at him. He's bald. He's got the muscles. He knows what he's fucking talking. And he's a doctor. Dr. Jones. Dr. Jones. Watch this before starting peptides. Doctor explains the risks and benefits. Perfect video for us, ladies and gentlemen.
In our clinic.
Let's get it.
If you're thinking about starting peptides, just stop, okay? Not forever.
Oh.
Just for the next 18 minutes, because here's what I see constantly in our clinic. Someone comes in after spending hundreds or thousands of dollars on peptides like BPC 157 or AOD or some growth hormone stack.
See, that's the other thing about peptides. They got fucking all these weird names: BPC 157, AOD 9604. Fucking injecting microchips into your body, man.
They found on freaking Reddit.
Injecting
The
AI.
forums told them they mixed it right, they injected it right, but nothing happened. Or worse, they felt terrible and they had no idea why. And when I look at their situation, 8 times out of 10, the problem wasn't the peptides. It wasn't a bad batch necessarily. It was that their injection technique was off. It was that they skipped the one question that actually matters before starting any peptide. Not which peptide should I take. The question is, am I actually ready for peptides? Does it make sense for me? And that's what we're going to cover today.
I like this guy already. See, that's a good question.
I'm going to answer the most common peptide questions that I get. What are they? Which ones to do? Are they safe?
Quagmire, listen, by sitting through this class and learning about peptides with me today, we can become looks maxers, dog. We can be like, we can mog clavicular one of these days. Like, come on, dude, you know, that'd be fucking sweet. Be fucking sweet. It'll be like we just did 2-3 years Dagestan.
Do they cause cancer? And when they actually work incredibly well? All of it. But I'm organizing this differently than most videos you've seen, because by the end, you're not just going to know about what peptides. You're going to know about whether your body is actually in a state to benefit from them. I'm Dr. Jones, DC, and I lead the coaching department at our nationwide telemedicine practice, where I work alongside prescribing physicians, helping patients optimize their metabolic health. I use peptides every single day as part of my own journey, and I've coached thousands of patients through peptide protocols. This isn't theory for me. This is what I see working and what I see go wrong every single day.
All right, yeah,
let's
so
start
he's
with
legit.
The basics. Question number 1. What even are peptides? Short answer,
What are they?
peptides are small chains of amino acids. These little guys right here, these are the building blocks of what makes up proteins. Think of them as tiny messenger molecules that tell your cells what to do. Your body already makes a huge number of them naturally. Estimates vary, but we're talking enormous, thousands of different signaling molecules. The peptides that people are talking about for fat loss, healing, recovery, those are just lab-made versions of signals that your body already recognizes. They're not drugs in the traditional sense.
So it's a synthetic version of a chemical that your body already naturally produces. Okay, so that's not sounding too bad already, all right?
Or like a language that your cells already speak. We're essentially providing your body with more of a specific signal that it already recognizes. Very different from pushing a signal that's foreign to the body with a drug. Okay, next question. Are peptides legal? That gets confusing fast. Some peptides like GLP-1s, tirzepatide, semaglutide, those are completely FDA-approved prescription medications, fully legal with the prescription. Others, like BPC, TB500, those exist in this gray area. There's
synthetic is bad, man.
I mean, yeah, synthetic is bad. A lot of synthetic things are bad, sure. But a lot of synthetic things are good, too. I mean, you know, come on. Not everything synthetic is bad. Synthetic isn't just a big buzzword for bad. You know, I mean, come on.
I'm sold as research chemicals, which means technically legal to buy, but not approved for human use. And then there's peptides that have been specifically restricted by the FDA.
Look at what semaglutide and tirzepatide have done for me so far. You know, I mean, look at this, bro. I'm beautiful. I'm more beautiful. Think about how much more beautiful we could get with some more peptides. Honestly, I'm not looking to. I'm not.
Quagmire69 says, I'm anti-peptide.
I'm gonna turn you pro-peptide by the end of this stream. Just watch. Just watch.
FDA recently. The landscape is changing constantly. What matters?
But yeah, I'm not necessarily looking for peptides to enhance looks or more weight loss, because I'm already good on the weight loss, and with the looks, I mean, mean, come on. But I want like the ones that are like
Poolspit Quagmire 69 says.
Yes.
New.
I'm telling you, but I want the ones that are like good for cognitive function, because they have ones that like enhance energy and like make you a little more sharp. You know, it's like it's almost like a diet Adderall, you know, but without the negative effects of amphetamines.
For you is understanding that research peptide, or more precisely FDA category 2
They also have
designation,
ones that are
it
good
doesn't-
for anxiety and depression and stuff like that. Peptides are really interesting, man. They're really interesting.
Poolspit Quagmire 69 says. That's called
That's
sex.
called
lol.
sex. And listen, I mean, that only works up to a certain extent.
doesn't mean tested and safe for humans. It means the opposite. It means there's limited human clinical data, and we're going to come back to why that matters later. Okay, third basic question. Are peptides steroids? And no. And this is important. Steroids take over your body's hormone production. That's why people who use anabolic steroids have to cycle them on and off to deal with the suppression and all those side effects. Peptides work completely different. They're signaling molecules. The concept is that they're telling your body to do something that it already knows how to do: heal faster, release more growth hormone, mobilize the fat. That's the mechanism that we see with approved peptides, and what animal research suggests through research peptide use, though human data is still limited. Now here's where people get tripped up. Not a steroid doesn't mean no risks. It doesn't mean do whatever you want. Peptides are powerful.
Although I'm not gonna lie, getting the one that gets you a little more swole, a little more buff, I mean, hey, it's definitely better for you than steroids, you know what I mean?
They're powerful tools, and when used wrong, they can still cause problems. Which brings us to the question that everybody really wants answered here. Are peptides safe? Okay, my honest answer, it depends entirely on you, not the peptide, on the state that your body is in when you start taking them. And this is the thing that most people completely miss. Based on what we see in our clinic, peptides don't fix things on their own. Peptides amplify things. They seem to amplify whatever state your metabolism is already in. If your metabolism is running well, insulin sensitivity is good, inflammation is controlled, hormones are balanced, we observe that peptides amplify those good results. Patients get the healing, the fat loss, the recovery that everybody's talking about. But if your metabolism is broken, if you're insulin resistant, you're chronically inflamed, your hormones are out of whack, in our experience, peptides can amplify that too. They either don't seem to work or they can make dysfunction worse. Think of it like putting premium fuel into a car. If your engine is tuned up and running clean, premium fuel can help performance. But if your engine is broken, the fuel injectors are all clogged up. I don't know if you guys are car people, but transmission is
Seems
slipping.
very
Premium
controversial to me.
fuel
That's
doesn't
not
fix
a definitive answer.
Yeah, no, definitely. I mean, yeah, they're definitely controversial, but that's why we're here. That's why we're learning. We need to educate ourselves.
any of that. You just wasted money on expensive gas. And in our clinic, we see this pattern constantly. People trying the do-it-yourself protocols that they see online, and they're getting poor results. Same peptides, with foundation work done first, it's completely different outcomes. Now, if this video is making you wonder about
And that's what we're doing right now. We're building the foundation.
your own metabolic foundation, whether you're actually ready for peptides, or if there's something underneath that needs to be addressed first, that's exactly what our free discovery calls are for.
No, I'm not booking a fucking discovery call, dude.
You can either text the number on the screen,
give me more
just call it
information.
Maria, 45-year-old marketing. She was doing everything right, but she needed to lose. That's an autoimmune condition where your immune...
Oh, we found hidden Hashimoto's? I have Hashimoto's. Fun fact for you, chat.
She looked. So once we figured all that out, we ended up adding her on BPC 157 and KPVs.
Yeah,
with
I
proper
get it.
medical
You
management.
work at a
Peptides
clinic that helps
amplify-
people manage
Which
their
leads me to the
peptides.
next question that everybody... If Maria hadn't gotten left, never known that she had Hashimoto's disease. She would have never known a week breaking down metabolic health, peptide protocols,
Cool,
and the stuff
dude.
that your doctor probably isn't telling you. Now let me show you exactly what to look for. How do I know if I'm ready for peptides? Now, you'll want to work with your healthcare provider on this stuff, but here are the 4 pillars that we check before putting any patient on peptide therapy. Number 1, insulin sensitivity. We like to look at a fasting insulin, maybe a HOMA-IR score. That's a simple calculation from your labs that shows how resistant your cells are to insulin. If you're insulin resistant, certain peptides may not work as well. The mechanism makes sense when you look at it. High insulin levels suppress the fat release. That's why we like to stack peptides like AOD 9604, which is designed to mobilize fat. You may struggle with
What does that even mean, mobilize fat? All right.
Insulin is constantly signaling your fat cells to stay locked, but AOD can help out with that. Okay, number 2, inflammation status. The labs that we talked about, CRP, those inflammatory markers, think of chronic inflammation like a static on the line. The theory is that your cells may not respond to peptide signals as clearly when they're dealing with inflammatory stress. In Maria's case, showed us what addressing inflammation can do. Pillar number 3, baseline hormones. We want a full functional thyroid panel, possibly cortisol, IGF, that's insulin-like growth factor. That's a hormone that tells your cells to grow. You need to know where you're starting at so you can track
yeah,
those
I need
changes.
to know all that.
Growth hormone
Sure.
peptides in particular can raise IGF levels. If you
I mean, yes, he's basically saying know your health before you start. All right, I get that. Comment peptides if you want a deep dive video.
Stacks. In the comments
about BPC 157. Supposedly BPC 157, that's the one that like they're touting as like a miracle thing. Not maybe not miracle thing, but supposedly like let's say like your knee is like fucked up or something, right? If you like inject some in your knee, it'll like be localized into that area and help your knee heal faster. Like that's what BPC 157 is supposed to be. It's like the healing peptide. But I don't need that one.
We know what's most relevant to your situation. Okay, category number 1, healing peptides. BPC 157 and TB 500, we call this the Wolverine stack.
The Wolverine stack is fucking wild. I love that name, by the way.
7 was originally derived from gastric juices. That's actually supported by research. In animal studies, it shows promise for gut healing, tissue repair, reducing inflammation. TB500 shows similar promise in the preclinical research for musculoskeletal healing. We're talking tendons, ligaments, joints, and patients who I coach who use these together report accelerated recovery. Though, of course, that we're still waiting for those human clinical trials to confirm what the animal data suggests and what we're seeing every single day in practice. But here's what most people miss when it comes to healing peptides. For this category, your inflammation status matters most. If you're chronically inflamed, these peptides may help, but based on what we see, they work even better if you're addressing what's causing the inflammation to be high in the first place. Fix the source, amplify the healing. Category number 2, let's talk fat mobilizing peptides. Everybody's favorite peptides. One of our favorites is AOD 9604. This one's interesting. See, this is a synthetic fragment.
You like the new emojis? Pretty fucking sweet, huh? I made a bunch of them like that.
Of growth hormone, specifically the residues 176 to 191 on this large growth hormone molecule. That portion of growth hormone is associated with fat mobilization. The concept is that it may unlock fat cells so that your body can access that stored energy. The clinical trial history is mixed. Early studies showed promise, though later pharmaceutical development.
That's what fat mobilization is? Hold on, I gotta open up Notepad, chat, so we can start taking notes here. Because we're learning, chat. We're learning. I'm taking this fucking seriously. Because I'm not just going to fucking buy some shit and inject it into myself if I'm not 100% certain what the fuck is going on. Okay, so fat mobilization. That's an interesting term. Let me write that down.
Was discontinued. Now, I think it was discontinued because they didn't know how to use it. For slow responders to GLP-1.
And he was saying that growth hormone did that. It helps with fat mobilization.
Medications, adding AOD is something that we do in our clinic, and it enhances results because what we've observed, insulin resistance seems to be a big issue here for this category. If you're severely insulin resistant, the theory is that AOD may be trying to open a door that insulin is holding shut. That's why we typically address the metabolic foundation first. And then category number 3, growth hormone peptides. CJC 1295 with ipamorelin is the classic stack. These are designed to stimulate your body's natural growth hormone release. Small studies show that they do elevate growth hormone and IGF-1, and patients often report improvements in recovery, sleep, and body composition, though long-term data is still limited. This category requires the most monitoring. These do raise IGF-1 levels based on available research, and that's where the cancer conversation comes in. We'll get there. Baseline hormones matter a lot. And then number 4, we got our GLP-1s, our tried and true.
Yeah, see, that's why I don't really want to fuck with the growth hormone ones or anything like that. Because if you have, like, cancer within your body and you're not like 100% sure that you don't, then that stuff has a potential to grow that cancer even faster, which is a scary thing to happen. So I'm not even gonna fuck with those because I'm a smoker. Who knows what the fuck's going on in my body? I didn't get no fucking PETA scan and completely vet my shit.
True GLP-1, tirzepatide, some
GLP-1s, baby. Now that's the one I love, though. That's the good stuff. Tirzepatide. Oh my god, I miss tirzepatide, guys. I'm on semaglutide right now. I've been thinking about getting on Retta, though. Retatrutide, because now I can get it. Now I found out about it, but we'll find out more about it in these videos. But Retatrutide, that's basically like the fucking the magnum opus of GLP-1s. Like, you got to think of semaglutide. This is my understanding, at least. Semaglutide is like level 1. Like, yeah, baby, you're getting in there, you're losing weight, it's nice, right? Then you got tirzepatide. Tirzepatide is like level 2, right? Tirzepatide, you're on the fast track. You're moving quick. You're rocking and rolling. That shit is falling off. And then Retatrutide, that stuff is supposedly like, you know, the fucking weight just flies off. It's insane because it's a mix between like 3 different peptide things, and they're calling it the triple G. That's supposedly the nickname of Retatrutide. So that's interesting shit. But we'll find out about that too.
Glutide and now Retatrutide, technically peptides, and for many people, this is their first experience with the peptide therapy. These work through appetite regulation and appear to support metabolic changes. And unlike research peptides, these are FDA-approved prescription meds with extensive clinical trial data and quality control. This is basic pharmacology. When you combine multiple compounds and something goes wrong or nothing happens, you have no idea which one was the issue. Start one thing at the lowest effective dose, track everything, and then add if needed. You can always add more, but you can't undo a bad reaction. Okay, next question. Do peptides have side effects? And the answer is yes. And they can vary by category. Healing peptides like the 157 and the...
That's a great note right there, honestly. Start at the lowest effective dose and then move forward. Because that's the other thing about doing this shit is I got to come up with my own protocol and dosing and all that sort of stuff. It's because when you buy it, it doesn't come with instructions. Because when you buy it, it's being sold, it says research chemicals not for human consumption, I'm pretty sure. But I'm going to be humanly consuming the fuck out of that because I'm going to be shooting it into my ass.
TV500, they appear well tolerated in the animal studies. And in my clinical experience, patients who I coach report very few, if any, negative reactions, of course, because we're dealing with high-quality 503A pharmacies. That said, formal human safety trials don't exist. The main theoretical concern with BBC 157 is the angiogenesis. What that means is it promotes blood vessel formation. In the animal research, this is actually its proposed.
See, that's another thing. Why, like, what if you promote the blood vessel fucking growing and can you grow wrong blood vessel? Is that a thing? I don't know. I'll let this guy talk.
Healing mechanism, but the same process could theoretically supply tumors with nutrients. So for anybody with active cancer, cancer history, or elevated risk, we avoid it in most cases. My doctors will have that conversation. But for most other people, the safety profile appears favorable based on the available data. Okay, fat loss peptides, AOD 9604, based on the limited trial data, it appears to have mild side effect profile. It was designed as a fragment of growth hormone like we talked about, but without any of the IGF-1 stimulating portion. So in theory, you're not getting growth hormone promoting effects. The most commonly reported issue in our clinic is just injection site reactions when technique needs work. But to be frank, we got rid of injections of AOD and we use troches. I love troches, and they're starting to fall out of my container there. But these troches here, you pop them into your mouth and they're good to go. Let me know in the comments right now which peptides that you are thinking about starting or what you're already on: injury recovery, fat loss, energy, anti-aging. And I'll share with you, because I respond to every single comment, what we do in our clinics in a situation like yours. Growth hormone peptides. This is where side effects get more real. Pharmaceutical growth hormone therapy causes well-documented side effects: water retention, joint pain, carpal tunnel symptoms, blood sugar changes. Whether growth hormone-releasing peptides like CJT-1295 and ipamorelin produce similar effects at typical doses, this hasn't been adequately studied long-term, but given the mechanism, we assume the risks may be similar, and we look for this. This is what my doctors are watching for. Which brings us to the question that I know you're waiting for. Do peptides cause cancer? Now, I did a full video
No,
breaking
but it
down
can
cancer
accelerate
concerns,
it.
so you should definitely check out that one if this is a big question
Feed
for you.
into
Here's the
existing
honest,
cancer,
nuanced
right?
answer, though. The
That's
cancer
what it
concern
is.
comes from one specific pathway, IGF-1. Multiple large population studies associate a higher IGF-1 level with increased risk of several cancers, including breast, prostate, colorectal. Growth hormone peptides raise IGF-1, creating a theoretical cancer risk. However, there's no long-term studies that have directly measured cancer outcomes in peptide users specifically, and that's where the concern comes from. The association data, not direct evidence. And guess what? Low IGF levels are also associated with cancer, and that's important to understand. This concern primarily applies again to those growth hormone releasing peptides, CJC1295, ipamorelin, tesamorelin, samorelin, the ones designed to actually raise IGF-1. Now, BBC 157, based on its mechanism, it's not expected to raise IGF-1. The research just hasn't caught up to the clinical use yet. And then TB500, same category, different mechanism than growth hormone peptides. And then AOD, it was designed as a fragment of growth hormone. So none of the IGF-1 stimulating portion is there. And so you get none of the concern with it. For growth hormone peptides, the research is nuanced. Most studies are under 12 months. Unapproved peptides lack clinical trials entirely. So we're looking at theoretical risk based on IGF-1 pathways. But that theoretical risk isn't the same as the proven risk, and it appears safe with responsible use based on what we know and what we've seen. This is very different from definitely safe forever. So our approach, we're screening cancer history. We use appropriate durations rather than indefinite use. We monitor with labs, and that's why growth hormone peptides aren't something that, how do I know if my source is legit?
That's a huge one, because all this shit is coming from China. So you got to make sure you got the right Chinaman giving you the right shit. So that's my biggest concern with these peptides, honestly, is finding the right Chinaman. You know, white boy gotta speak a little Chinese.
Probably the most serious problem. Okay, many companies can give you a COA, a certificate of analysis. This can be faked.
Yep.
Research grade peptides doesn't mean medical grade. I've had patients bring me vials that were cloudy, vials that did nothing for them, vials from sources that disappeared after one order. The reality is, with research peptides, you're taking a gamble on quality. Reputable compounding pharmacies with actual oversight exist for a reason. And again, when that company says, we did our analysis, it's high quality, you want me to believe you.
Yeah, we did our analysis. Your peptide is highest quality.
When you're the same company that's literally lying about not for human consumption and turning around and selling it to humans. You kind of lost our trust there. You kind of lost the...
Yeah, that's the one thing about the peptides, man. It's just finding the right source. Hey, peptide people, if you got the plug, hit me up. I'm interested. Let's clip that shit, chat. So I could spread that around and the peptide people will hit me up.
My trust there, but I respect everybody's decision and what they got to do for their health. Okay, next question. How long until peptides work? Peptides act fast. That's the cool thing. They're in your system same day, but visible results, injury healing, fat loss, body composition changes, those can take weeks to months. And here's what patients in our clinic typically report when the foundations are addressed first. These are clinical observations. They're not validated by controlled studies. The BBC 157 and TB500, with solid inflammation management, patients that we work with often report meaningful progress on nagging injuries, sometimes within weeks, and then definitely by a month or two. Fat loss peptides, while addressing insulin sensitivity, patients report noticing enhanced results after a couple weeks use. Remember Maria? Once we addressed her inflammation, things started moving in the right direction. And then there's growth hormone peptides. With proper lifestyle, patients commonly report better sleep and recovery fairly quickly, with body composition changes developing over months. Okay, next question. What results should I expect? I need to be straight with you. Peptides are the sidekick, not the hero. They're the accelerator, not the engine. You know, if you like cars again, I don't know why.
And that's the exact thing, like anything else. It's not like you fucking do it and then that's the effect you get. I mean, except with the weight loss one, you fucking lose weight. But with all the other stuff, the other intended effects you want to get, it's just like a crutch to help you achieve the goals you're aiming to achieve with the peptide you're choosing to do. So get exercise with it or do what you have to do. Fucking, bone mash if you're taking some fucking, some kind of peptides you inject in your face for something, some BPC 157 up in there. I don't know, bro. Let's go.
Keep jumping on the car train here, but NOS. Let's put some NOS on the car. You still got to have an engine. Now, if you want me to make a complete video breaking down exactly the labs, the markers that we check before starting any
yes, I want you to make that
so
video.
That you know exactly what to look for in. Okay, should I start peptides? Here's the framework I use with every single patient. 3 questions. Number 1, is my metabolic foundation solid? Can you honestly?
I would say yes. I don't have the blood work or the labs to prove that, but my health it's not the best right now, but it's decent.
Assess your insulin resistance, or
it's getting better. We exercising and eating right,
sensitivity for that matter, your inflammation status, your hormone levels. Do you know where you stand on those 4 pillars? If you're guessing, you're gambling. Question number 2, do I have access to quality controlled peptides? Not research grade from a website that might not exist next month. Especially if you guys have been paying attention, the end of this year, 2026, depending on when you're watching this, many of the main research companies, they're closing down. The whole Wild Wild West peptides, it's changing. Actual pharmaceutical quality compounds from a source with real oversight.
Oh, no.
And then
that's bad. That means they're going to get a lot more expensive, and you might even have to get prescriptions for them. That sucks. Fuck. So that means stock up on your peptides this year.
3, do I have somebody working with me to monitor this? Labs, adjustments, catching problems before they become...
That's crazy, man. They got to keep the Wild Wild West thing going. Wild Wild West.
I'm serious. Someone who understands peptides and metabolic health. See, here's the honest truth. Most people can't accurately answer these 3 questions on their own. That's not gatekeeping. That's the difference between getting real results and wasting
hundreds of thousands. All right, I get it. Now you're going to sell your thing. All right, dude. Yeah, that's pretty sweet. Okay. I'm breaking down the peptide craze. Do we really need that? I mean, I like this guy's videos, though. Oh, no, this is what I'm looking for here. This is the big thing. How do you correctly prepare and inject them? Because, like, they come to you in a powder, and you gotta mix it with a special water, and then you gotta... Man, it's something, it's interesting. Let's find out. Because that I don't know. Because even though I'm doing peptides right now with the semaglutide, but I'm getting the pharma shit. It's in an auto-injector. I've never actually put anything in the syringe and injected it into my ass yet. So let's see what that's going to be like.
Their first vial of peptides, and they have no idea why they did it. They shake it like a freaking protein shake. They spray the water directly onto the powder. They store it completely wrong. And they wonder why their $200 peptide bottle or their $1,000 peptide stack isn't working. I'm Dr. Jones, DC, and I lead the coaching department for our nationwide GLP-1 and peptide clinic, where I work alongside our prescribing physicians, and I've coached thousands of patients through their first peptide injections. And I inject peptides myself. Today, I'm going to show you the exact process to prepare and inject your peptides the right way. But more importantly, I'm going to show you the 5 mistakes that destroy your peptides, or worse, can even cause some complications. So you never waste another vial again. Let's get into this one. Before we get into the process, let's make sure that you have everything you need. And I'm not just telling you what to grab.
You know what I'm going to do? Actually, one thing I got to do while I'm in this view here, I'm going to flip it horizontal so it's like this. So it's like I'm looking at the fucking video while I'm here, It'll be weird though, because when I go like this, I'll flip around. No, that's cool. I like that. Hey, how about that? How about that, chat?
I'm going to be telling you why each piece matters. Okay, number 1, first, your peptide vial. This is your lyophilized powder. Now, lyophilized, that's the freeze-dry stuff that's inside the bottle. That's what we're going to reconstitute. Reconstitute means we're going to turn it into a peptide solution that you can inject. Number 2, your bacteriostatic water. This is critical. Bacteriostatic water contains a preservative called benzoyl.
Bacteriostatic water, chat. Bacteriostatic water.
Alcohol. That prevents bacterial growth. This gives you 28 days of safe use after mixing. If someone gives you a plain sterile water instead, contamination risk begins immediately.
Huh, interesting. 28 days of safe Use after mixing.
Once that bottle is used.
Yeah, because that's a scary thing. Like, imagine you mix some together and then like it's growing bacteria or something. Oh, no.
Most guidelines say to discard it within 24 hours, but the preservative protection, it's just not there from the start. And third, you need 2 different syringes. And here's why. For reconstitution, you want a larger, say 3mm syringe with an 18 to 23 gauge needle.
Good shit, I forgot I'm gonna have to buy syringes and shit too.
Larger needle means you can draw and inject the water quickly, but for the actual injection into your body...
Can I, like, put it into an auto-injector? Is that possible? That would be fucking cool if I could do that.
You want an insulin syringe with a tiny little needle, 28 to 31 gauge needle, much smaller and virtually painless. And fourth, you're going to need some alcohol prep pads. You'll use this to clean the vial top and your injection site. And fifth, a sharps container for safe needle disposal.
Actually, that's easy to remember. Let me go back and write those 3 things down. Okay. So 3mm syringe for mixing.
23 gauge needle. Larger needle means you can draw and inject the water quickly, but for the actual injection into your body, you want an insulin syringe with a tiny little needle.
Wait, what gauge did he say it was?
You want an means you can draw
18 to 23. To 23 gauge.
And inject the water quickly, but for the actual injection into your body, you want an insulin syringe with a tiny little needle, 28 to 31 gauge needle, much smaller and virtually painless. And fourth, you're going to need some alcohol prep pads. You'll use this to clean the vial top and your injection site. And fifth, a sharps container for safe needle disposal. Don't skip on this one. Some states legally require proper sharps disposal. Now, if you're looking at all this and thinking, I want help figuring out which peptides are right for me, or I need guidance on dosing and protocols, that's exactly what we do. You can either text the number on the screen or you can check out the link in the description. But first, let me show you exactly how to reconstitute your peptides. Reconstitution is when you turn your freeze-dried powder into an injectable solution. So let's walk through the exact process. First, let both your peptide vial and your bacteriostatic water come to room temperature. Don't reconstitute anything cold. A few minutes on the counter is all you need. And by the way, don't keep your bacteriostatic water in the fridge. Leave it out, room temperature. That's going to make this process easier. Clean the top of your bacteriostatic water vial with an alcohol.
I'm going to save this video. This seems like a good one. How to reconstitute. Yeah.
Prep pad, take your 3mm syringe with the larger gauge needle and draw the water. The amount depends on your specific peptide. Your provider should give you the exact instructions, but a common dilution is usually 1 to 2 milliliters per vial. Now clean the top of your peptide vial. Now here's the key technique. Tilt the vial slightly, aim the needle at the glass wall, not at the powder, and insert the needle and slowly inject the water, letting it run gently down the side of your vial. This protects the peptide structure. Remove the needle. Now gently swirl the vial in a circular motion. Don't shake it, just a gentle swirl.
This shit is very interesting, chat.
Let the powder dissolve naturally. This may take a few minutes, and that's perfectly fine. When it's ready, the solution should be completely clear. No cloudiness, no particles, no foam. If it looks good, you're ready to draw your dose. Now, if this is already making you feel more confident about handling your peptides, hit that subscribe button now because we put out 4 videos per week covering the topics of peptides.
Should I subscribe? He's almost earned my subscription.
How to draw your dose correctly. So you take that insulin syringe. Remember,
His
this
videos
is the
are pretty
smaller
good.
one with the 28 to 31 gauge needle. Remove the cap, clean the top of your peptide vial again with a fresh alcohol prep pad. Insert the needle into the center of the rubber stopper and turn the vial upside down. Make sure the needle tip is submerged in the liquid. Pull back the plunger slowly and draw out slightly more than your target dose. Now check for air bubbles. If you see any, tap the syringe gently and move them to the top. Then push the plunger just enough to release the air and bring yourself to the exact dose. Quick tip on reading insulin syringes. They're marked in units, so 100 units equals 1 milliliter. So if your dose is 0.2 milliliters, that's 20 units on the syringe. Your provider will give you the exact numbers, but understanding the markings helps you stay precise. Your syringe is loaded. Now let's talk about the actual injection. If you're nervous about the needle, that's completely understandable. But what most of my patients tell me is that after the first injection or two, the anticipation was way worse than the actual experience. These insulin needles are super tiny, you won't even feel it.
Yeah.
So let's pick your injection site. The best spot for most people is the abdomen. Your
Oh,
belly area.
look,
You want
look,
an area
look.
That's at least
You saw that? You saw that scar at the butt? He used to be fat probably, and he lost a lot of weight with GLP-1s and peptides, I bet. And I think that's a scar from when you lose the skin. Because that's what happens when you get fat and you lose all the weight. You got skin. You got all this extra skin on you, and the only way to get it off is to cut it off because it doesn't fucking like shrink back.
your belly area. You want an area that's at least 2 inches away from your belly button with enough soft tissue to pinch. Your outer thigh works too, the front or the side midway between your knee and your hip. Upper arm is an option, but harder to reach on your own. Clean your injection site with an alcohol prep pad using a circular motion. Let it air dry until the skin feels dry, typically around 10 to 15 seconds. Don't blow on it, don't wipe it, just let it evaporate completely. This prevents stinging and ensures proper disinfection. Now here's something most tutorials get wrong. The angle of your injection depends on a few factors. As a general guideline, if you can pinch at least 2 inches of tissue at the injection site, 90 degrees straight in typically works well. But if you have less pinchable tissue, 45-degree angle helps keep the needle in the fatty layer.
See, now that's something I didn't even know when I'm doing the Ozempic, is to like pinch the tissue, get it in the fatty layer. Okay, that makes sense, because I do it in the side of my leg. I do it like in the thigh, because it feels weird injecting it into my stomach, even though my stomach is where I got the most fat. It just feels weird doing it there, you know? I don't know how to explain it. I don't like people touch my stomach. Don't touch my stomach.
Your specific needle length matters too as well, so your provider might give you different guidance based on your anatomy. Pinch the skin between your thumb and your forefinger, lifting the fatty tissue away from the muscle, and on the count of 3, insert the needle smoothly. Press the plunger slowly and steadily until it's fully depressed. Count to 5 before you withdraw the needle. This ensures the full dose is delivered and nothing leaks back out. Then pull straight out and apply gentle pressure with a cotton ball if needed. One more critical point. Rotate your injection sites every single time. I see this constantly in our clinic. Someone injects the same spot over and over again, and they develop something called lipohypertrophy. That's a tissue buildup that blocks proper absorption. Keep your injection site at least a single inch apart. Use a system here. Left side of your abdomen one day, right side on the next day. Then thighs. Predictable rotation means predictable results. Now that you know how to inject, if you want me to make a video breaking down the exact protocols that we use for specific peptides like BBC 157, TB 500, or AOD 9604, drop it in the comments which peptide that you want me to cover first. Now, let's talk about storage here, because your peptide can still go bad after you've done everything right. As soon as you reconstitute your peptide, it goes into the refrigerator, not the freezer. The refrigerator, you want a consistent temperature between 2 and 8 degrees Celsius, which is the standard refrigerator temperature.
I mean, yeah, store it in the fridge after you do it, of course. I'm still gonna write that down. Store in fridge after you mix. Yeah.
With bacteriostatic water, your reconstituted peptide is good for up to 28 days. I know many people will tell you that's good much longer, but we're just going to go with the legal recommendation of 28 days. What you do is what you do. Just stay safe out there. One thing most people don't realize, many peptides are light sensitive. If your vial is clear glass, wrap it in aluminum foil or store it in a dark container.
Okay. Store in dark container. Light sensitive. That's really interesting, actually.
Light exposure can degrade the peptide over time, especially peptides containing certain amino acids. Now, here's how you know if a peptide has gone bad. Before every injection, do a quick visual check. The solution should be completely clear. If you see any of these warning signs, discard the vial immediately. Cloudiness or haziness, visible particles or chunks floating in the solution, a gel-like consistency instead of a liquid, any...
Yeah, okay, so if it ever looks fucked up, don't inject it. I got that. Yeah, I'm not... If it ever looks like that, and it's supposed to look like clear nothing, yeah.
discoloration or foam that doesn't go away. A small amount of bubbles from the injection process is normal, but persistent foam or cloudiness means something went wrong.
Yeah.
Don't inject it. It's not worth the risk. Okay, now you know the complete process from start to finish. Now let's talk about the 5 common mistakes that you need to know to prevent destroying your peptides or causing complications. So mistake number 1, shaking the vial. I had a patient bring in a vial that looked like a freaking snow globe. Foam everywhere, cloudy.
Do not shake it. I'm gonna put that higher. Do not shake the vial.
Chunks floating around. She'd been shaking it like a protein shake, thinking that she was mixing it faster. This was a $1,000 bottle of BPC 157 completely destroyed. Peptides are chains of amino acids, and they're very, very delicate. When you shake them, you actually break the molecular bonds and you end up creating foam that denatures the structure, essentially.
If peptides are amino acid, does that mean that like BCAAs that you would take for, you know, as an exercising supplement, are those technically peptides? Branched chain amino acids, right? Hold on. Let's see. Are BCAAs peptides? They're not peptides. They're technically they're individual amino acids. Peptides are chains of amino acids. Gotcha. All right, Doc, continue.
Makes it non-effective. And then you can cause aggregation where the peptides clump together and they lose effectiveness. Always gentle swirl, never shake. Mistake number 2, spraying water directly onto the peptide powder. When you add bacteriostatic water, aim at the glass wall, not the powder. Let the water run gently down the side. Direct spray creates the same foaming problem and degrades your peptide before you even use it. Mistake number 3, reconstituting cold peptides. If your peptide just came out of the freezer or fridge, let it reach room temperature first. Cold reconstitution can damage the molecular structure. Same with the bacteriostatic water. Room temperature for both. Mistake number 4, wrong injection angle for your body type. I see this constantly. Someone watches a tutorial, jabs at 90 degrees, and hits a muscle instead of fat. Then they're sore for 3 days and wondering why their peptide doesn't seem to work as well. If you have less pinchable tissue, use the 45-degree angle. And if you can pinch at least 2 inches at the site, then 90 degrees is typically fine. Match the angle to your body and your needle length. And then finally, mistake number 5, not letting the alcohol dry. After you clean your injection site, let it air dry completely.
So I should just shoot it into my ass. Because that's why they tell you to do it into your stomach and your thighs. Because that's where you would have more tissue, right? So in theory, doesn't that just make sense that I should just shoot it into my ass? Because I got a big ass, dude. I know some people don't. But I got that fucking thing on me. So, hold on, let's see. Can you inject peptides into your ass? Yes, outer portion of the buttocks is a common and safe injection site for subcutaneous peptide injections. Wait, did I say that? Subcutaneous peptide injections. Subcutaneous injection involves injecting into the fatty tissue layer under the skin, which is the standard method for administering most peptides. Okay, perfect. So I'm gonna be injecting it into my ass. I'm just gonna stop fucking around with my thighs because I got muscular thighs, guys. My thighs are nice. Let me fucking tell you. Come on, I don't play around. All right, cool. Which video are we on? This one.
Typically
continue,
around 10
doctor.
to 15 seconds, depending on conditions. Injecting through wet alcohol is going to sting. You're not gonna.
I'm gonna clip that for later. Clip farm in the peptide stream.
Like how it feels. And more importantly, it hasn't fully evaporated. You haven't fully disinfected. Patience here prevents problems. Those are the 5 mistakes. Avoid them and you'll protect your investment and get better results from every single injection. So let's recap here what you just learned. You know the equipment that you need and why each piece matters. You know how to reconstitute your peptides properly, letting the water run down the wall and gently swirling to dissolve. You know how to draw an accurate dose and remove air bubbles. You know how to inject subcutaneously into the fat tissue and at the right angle for your body. And you know how to rotate your sites every single time. You know how to store your peptides and the warning signs that means it's time to discard. And you know the 5 mistakes to never make: no shaking, no direct spray, no cold reconstitution, proper angle for your body, and let the alcohol dry. Congratulations, you now know more about peptide injection than 90% of the people that are doing this currently at home. But here's the thing, injection technique is just one piece, but the bigger questions are which peptides are right for your goals. What's the right dose for your body? How do you time it? How do you stack these peptides if you're using more than one? And how do you adjust as you progress? And what's the long-term goal here? And how are you gonna get there with peptides? That's what we help people figure out every single day. If you want a personalized guidance on your peptide protocol, dosing, timing, which peptides actually make sense for your situation, that's exactly what we offer our free discovery calls. You can either text the number on the screen or you can check out the link in the description and you'll get to speak with one of our patients. I wanted to say there's a lot of recent buzz where people think peptides are much more stable than we had thought before, meaning you don't have to be so sensitive to protecting your peptides. I've seen that literature, but I still treat my peptides this way, and I still recommend to patients to.
Yeah, I would store them properly, and just keep them cold and in the dark. I mean, that's yeah.
Treat your peptides this way. It's potentially promising to know that maybe the peptides are more stable than we thought, but until we know for certain, that's a big investment financially speaking, and it seems a little silly to just think that those peptides are completely fine when you might be accidentally destroying them, because what we've seen so far just means that they might be more stable. It doesn't mean that there's no problem at all. So just wanted to share that insight with you. Now, I think the most underrated peptide is GHK copper. And so if you guys haven't checked out this video, check out that video right there where I do a deep
GHK copper. That's the blue shit people are injecting. Because one of them, it's literally like a blue liquid. And it's not even a peptide, but they call it a peptide. Okay. So that was interesting. What else? So now I want to learn more about... Let's put on the music. I want to learn more about, what was the one? Oh, Solank. Yeah, let's look into Solank, chat. Let's see if Dr. Jones has a video on Solank. Solank, Dr. Jones. Dr. Jones makes some good videos. He made a reel about it. Alright, let's see what he says. I don't think we're gonna watch this one anymore. But this guy's good too. I like Dr. Alex. So I'll pull up his page. This is Dr. Jones. Okay, so that's their pages. Solank. What do you gotta say?
C-Max and C-Link. These are the Russian peptides with decades of clinical use over there. C-Max is the focus and cognitive enhancer. See, it works on something called BDNF, brain-derived neurotrophic factor, a brain growth factor. And then C-Link, which does have a little bit of that effect, but it's more in the anti-anxiety category. It's calming without any sedation. The human data, these have been used clinically in Russia for decades and are actually on their national essentials medicines list. Is it Western FDA approved data? No, but it's not zero either. There's
See, now that means there's something to this. It's on Russia's national essentials medicines list. I mean,
real clinical experience behind these compounds. Course correct easily. These are very short-acting nasal sprays. You stop, they clear. Downside,
and they're both nasal sprays. You don't even have to inject them. But I still kind of want to inject them. I'm not gonna lie, chat.
in my personal experience using both and gathering feedback from our patients, they're pretty clean. The Western safety documentation is limited, of course, but I haven't seen any significant issues in patients who I coach who are using these regularly. B tier for both. Solid options for cognitive support with low experimentation risk. By the way, if this framework is starting to click for you, hit that subscribe button right now because we put out 4 videos per week on peptides, GLP-1s, and metabolic health strategies.
What's the full video below? I don't see no full video below. Where's your video on Solank, dude? Tell me about Solank, Dr. Jones. I want to know now. It's got a video revealing the top 10 most powerful peptide stacks. I bet Solank and Siva is one of them.
Peptide therapy is powerful.
Let's see. Copper, CJC, PT, Thymosin, Samax, and Solank, baby.
Go. Okay.
Let me take note of that, because those are the two I'm really, really interested in. Samax, Solank. That's the stack I'm interested in, is the Samax Solank stack.
First stack is for calm and focus, Cmax and C-Link. Cmax and C-Link are for cognitive optimization. These two Russian peptides are always used together in many cases because they create a perfect balance. Cmax gives you the laser focus and the mental performance, but C-Link can kill anxiety without the sedation. Together, you get a flow state that I like to say. And here's the synergy. Research suggests that Cmax may increase brain-derived neurotrophic factor, or BDNF for short, which is like fertilizer for your brain. Patients prescribed Cmax commonly report improvements in learning, memory, and cognitive processing, which aligns with what we'd expect if you increased BDNF. Guess what, by the way? Deep intermittent fasting and long fasting can also increase BDNF2 as well. This is being enhanced. Now, C-Link is going to modulate.
Okay, so basically this stuff is going to make me feel like I did when I was fasting. So when I was doing keto years and years ago, I would be fasting for multiple days at a time, and I would feel on top of the fucking world. Like I would... Peak performance mode is what I called it, because that's what it was. That's what it literally, peak performance. I was sharp, no brain fog, no nothing. It was a beautiful state of mind. So okay, Samax Solank, yeah, that's it, dog. That's gonna be it.
In the brain to reduce anxiety, promote calm, but without making you feel tired or
It's that BDNF, and okay.
foggy like traditional anxiety medications do. What you get is cognitive performance with calm, clarity, and focus. Sharp, focus, and productive, but not anxious and wired. That's the magic combination that pharmaceutical stimulants can't come close to. Now, both are in nasal spray because we do want this in the brain. Nasal is optimal here. Dosing can be anywhere around 1 milligram per application up to 3 times per day, switching between nostrils. Some patients use it daily for cognitive demands. Others use it situationally, like a bit of a nootropic, where only when I need it. If you are running it every day, give yourself a break probably after 2 to 3 months. That's what our doctors usually do. Of course, frequency is going to vary based off your needs. Some patients need it more often and some people don't. Others will use it strategically before high pressure situations. Your response is going to vary based off of your lifestyle and your overall health. Lisa, 48-year-old business owner, she was experiencing what we call zombie mode, tired, brain fog, constipation, cold all the time. Now, we isolated that there was a metabolic cause of this. Her metabolism shut down from under eating and chronic stress. So we helped her fix that. That was the foundation. But then we added some Cmax and C-Link for cognitive optimization. Her mental clarity came back fast. Energy returned. She could finally focus again for her business meetings without feeling like she was operating through a mental fog. Now, Cmax and C-Link will optimize the brain that you have right now. But what if you could actually grow new brain cells and build new neural connections? That's not science fiction anymore. That's exactly what the next stack does in early animal models. Dihexasynapsin for powerful brain repair. This stack is different from the last one. See, Cmax and C-Link optimize the brain that you have, but dihexa and synapsin actually promote the growth of new brain cells and new...
That's interesting. Hold on, let's write that down. Dihexa and synapsin stack promotes the growth of new brain cells. What? That's fucking wild, dude. So yeah, Samax and Solank is like the brain optimizer. Dihexa and synapsin. Let me show you guys my notes. Dihexa and synapsin is like the fucking brain growth stack. I don't know if I'm going to get into those, but hey, they're interesting. They are interesting. Let's see.
Neural connections. We call this neurogenesis, something that we thought not possible. Again, early models.
Shrooms cause neurogenesis. Fun fact for you.
Show us this potential, that growing new brain cells, and another process called synaptogenesis, which essentially means creating new brain connections between those cells. So here's what makes dihexa so interesting. In our practice, patients that my doctors have prescribed this to often report noticeable cognitive improvements that seem more pronounced than what we've seen together with other neurogenic compounds. Alzheimer's, neurodegeneration, this is where this really shines. The research on dihexa, of course, is still emerging, but the mechanism suggests that it may promote the neurogenesis and development of new brain cells and connections. More more effectively than any other peptide that we've seen. Now, synapsin proteins are essential for the synaptic vesicle formations. That's how your brain cells communicate with each other. Together, these peptides don't just help your current brain work, they help you build a neural infrastructure. Synapsin is really good for chronic brain injuries too as well. Synapsin is about 0.4 milligrams per day as a nasal spray. You run these peptides one at a time, or...
And you can do nasal sprays with them too. Huh. So I won't have to shoot nothing up.
stacked together depending on what your doctor says for maybe like a 3-month cycle, and then you take a break. Cycling is critical because of how powerful these peptides are and their neurogenic effects and impacting the brain. I got a real patient story to show you what I mean. Nancy, 60-year-old grandmother, was experiencing severe metabolic shutdown from undereating, cloudy thinking, zero energy, brain fog so bad that she couldn't follow conversations. Our doctors did a systematic metabolic reset over several weeks. They brought her calories up gradually. Once her metabolism was functioning again, we added brain repair peptides, improving her cognitive function. And we threw in some creatine too as well. Mental clarity returned like no other.
Creatine is very good for the brain, chat.
She felt like herself again. Now, medical supervision is essential here because these are powerful compounds. Now, who's going to benefit the most?
As a matter of fact, let me get mine in for the day. Ooh-wee. Hold on, chat. Hold on. Got to get the creatine in so we can think a little sharper. You know what I'm saying, chat? I like to dry scoop that shit, man. Just get it all down at once, you know, instead of like filling up a whole water bottle with it. Because I get the unflavored powder. So, you know, you just take it all down at once if you do the dry scoop. I mean, you gotta dry scoop it, chat. You gotta dry scoop it. Delicious, chat, delicious.
Most people with traumatic brain injuries, cognitive decline, age-related memory issues, your doctor monitors the whole cognitive process and determines cycling strategy based off of how you're progressing. Now let's talk about the foundation of everything, cellular energy, aka your mitochondria. This next stack, MOTS-c and SS31 for
Mitochondria? I was muted there for a second. Sorry, chat.
Mitochondrial health. Think of mitochondria like the batteries of your cells.
The powerhouse of the cell, mitochondria. All right, I could get down with helping out the mitochondria. I'm not going to lie.
These target different aspects of the mitochondrial function, though. So let me be clear about what each one does. SS31 is more for healing the mitochondria itself. This is for people with mitochondrial disease, heart disease, chronic fatigue from cellular damage, neurodegenerative conditions. Basically, the worse that your health can be impacting the mitochondria, SS31 is where you start. There's really good data showing how it stabilizes cardiolipin, a critical structure for heart health. Dosing can be 20 to 60 milligrams per injection, 2 to 3 times per week. This is therapeutic. You're addressing mitochondrial dysfunction. Now, MOTS-c is also going to help mitochondria too as well. Don't get me wrong, for these conditions, but it's a little bit more for the optimization side. So if you have a lot of health issues, starting with SS31 makes sense first, and then you optimize after with MOTS-c. The research suggests that MOTS-c will activate the AMPK pathway. Think of the AMPK like your body's metabolic master switch that tells your cells to burn fat for fuel, and it may promote the creation of new mitochondria itself. Patients prescribed MOTS-c typically report improved energy and metabolic function, which is what we'd expect when you look at these mechanisms. This is the one that I personally use at 10 milligrams once per week to stay lean and maintain optimal energy throughout the year. With my prior history, I'm convinced that I have some sort of underlying thing that is driving me to be a little bit more insulin resistant. And so when I added a maintenance dose of MOTS-c alongside my microdosing GLP-1s, things changed dramatically. Now here's the stack that my doctors usually do.
Did he just say he's microdosing GLP-1s? Is that a thing? Microdose GLP-1s? That's interesting. I'm going to add that to my notes here. Hold on. So I'd probably do that with retatrutide, honestly. Microdosing GLP-1s. It makes sense. I guess you do that after you've lost weight just to maintain. That's pretty cool. Fucking microdosing GLP-1s, dude. Holy moly.
You off at, say, 3 times per week for up to 2 to 3 weeks, 10 milligrams each injection, 3 times a week for the first 3 weeks. Then you taper down to a single injection and run that for at least another 2 to 3 months. One of our patients, Nancy, 60-year-old grandmother I mentioned earlier with severe metabolic shutdown, once they restored her metabolism and cognitive function, they then added MOTS-C for energy optimization and accelerated fat loss too as well. She went from 0 energy, couldn't feel like she could function, to feeling like herself again. That's what proper mitochondrial optimization can do. Remember, these serve different purposes. SS31 for disease and damage control, dose adjusted based on severity, and then MOTS-C for optimization and further improvement. The loading phase and then maintenance. They're not taken together, different peptides for different patient profiles, and you could do one and then the other. Now, I know the mitochondria stuff is confusing because there's a lot of lifestyle at the same time. If you want me to do a deep dive video into mitochondria health, the whole peptide and lifestyle combo, the thing that we do with our patients, let me know in the comments what metabolic issues you're struggling with so that I can figure out which video to make for you. Now let's talk about healing injuries at a superhuman rate, aka the Wolverine cycle, BPC 157 and T.
Fucking Wolverine cycle is still so cool, dude. I don't know if I want to... I guess we'll watch the Wolverine stack. Nah, we already know enough about it. It's the growth hormone and the other one. Alright, that's not really what I'm interested in, so... Casting African spell prank. I fucking love that shit. Maybe we'll watch that later. Not now, though. Dr. Alex Jones, or Dr. Jones, Dr. Alex Jones. I wonder what Alex Jones thinks about peptides. NAD+. Let's find another video about Solank, I guess. The truth about Solank, and it's from 2 years ago. Huh. Okay. Let's see what they were saying 2 years ago about Solank.
Hi everybody, and welcome to another episode of The Anxious Resistance. Today I'm talking about Solank. Now, Solank is a synthetic peptide that has been shown to have various benefits for the brain and for mental health. It is derived from a natural peptide called tufsin, which plays a role in the immune system and the central nervous system. Solank is widely used in Russia as a medication for anxiety disorders, but it is also considered a nootropic or cognitive enhancer because of its effects on memory, learning, and mood. In this video, we will explore what Solank is, how it works, what evidence supports its use, what side effects or risks it may have, and what are its pros and cons. So first off, let's dive into a little bit more detail about what Solank is. Solank is a heptapeptide, which means it consists of 7
Heptapeptide.
amino acids. Its chemical name is TKPR-PGP. It is a synthetic analog of tufsin, a tetrapeptide, that is produced by the spleen and stimulates the immune system. Solank was developed by Russian scientists in the 1980s as a way to enhance the effects of tufsin on the brain and central nervous system. Solank is administered as a nasal spray or an injection. Okay, so let's talk a little bit about this history. You've heard me.
Could I just get the Russian pharmaceutical version of this instead of buying shit from a Chinese manufacturer? Like, look at that, because they already have tried, tested, and proven shit that's pharma grade. It's just Russian. Huh. Let's look into Solank. Solank, fucking already made in Russia as a drug. Maybe look into getting the Russian version instead of shit from Chinese. Could be better, chat. I mean, because it's been used there for years. So, see, that's another thing that kind of eases the anxiety about this one, is they've literally already been using it in Russia for years and years. W Russians, chat. W Russians.
Mentioned a couple of times Russia. So this was invented in Russia. It was created by researchers at the Institute of Molecular Genetics of the Russian Academy of Sciences in Moscow. They were interested in the potential of tufsin as a regulator of both the immune system and the central nervous system. However, they found that tufsin was unstable and rapidly degraded in the body. So they modified its structure by adding 3 more amino acids to make it more resistant to enzymes. They also tested various analogs of tufsin and found that one of them, called TP7 or Solank, had the most promising effects on the brain. Solank was first tested in animal models and then in human clinical trials. It was approved as a medication for anxiety disorders in Russia in 2009, so it's a fairly recent medication for Russia even. So how exactly does this work? I talked a little bit about it, but
I mean,
Solank mimics the effects.
That's like relatively recent because that's in the past 50. It's been used for 15 years there, it looks like then.
Of that tufsin on the brain and nervous system. Tufsin is known to modulate or modify the activity of various neurotransmitters such as serotonin, dopamine, norepinephrine, and enkephalins. These neurotransmitters are involved in regulating mood, cognition, motivation, stress response, and pain perception. Solank also influences the expression of brain-derived neurotrophic factor, a protein that promotes the growth and survival of neurons and synapses. BDNF is essential for learning, memory, and neuroplasticity. Solank may also affect the balance of cytokines, which are molecules that mediate inflammation and immunity. Solank may have anti-inflammatory and immunomodulatory properties that protect the brain from damage and disease. So what evidence is there out there that Solank works? Solank has been studied in various animal models and human clinical trials for its effectiveness on anxiety, depression, memory learning, alcohol withdrawal, and other conditions. Here are some of the main findings. And again, you can find these links in the full article that will be in the description for this, so you can go to our website, check out all the links and things that are connected to this article. Solank reduced anxiety and stress-induced behavior in rats and mice. Solank improved short-term and long-term memory in healthy volunteers. Solank enhanced...
Wait, hold on 1 second, chat. I'm curious. Big Waffin is live right now, and he's doing like a call-in stream. I wonder how that's going. Let's see.
What do you mean?
Does he have a call?
For your butt sex?
I have to use the douche for my butt.
Use a douche? What the fuck is going on?
Yeah, what is that thing? My gay friend told me to do it.
There's different things called anal bleaching. Anal bleaching is a great thing to use. There is douches. You can douche your butthole. I was in the shower and I accidentally sprayed some water up my ass because I like to take the thing and get in there real good. And it went up my hole. Maybe that's why I'm constipated, babe.
What? Yo, what did I just come into here?
My wife, her name is... Her name... I can't tell her name. She doesn't want to be on stream.
I gotta go. I have diarrhea.
Chat, should we call in?
Oh, shit, dude. This is great, isn't it?
Chat, we're gonna call in.
The number is 908-336-1292. I am your host, Big Waffin. And we are on a roll right now. We're on a big roll. We're on a big roll like butter.
We're calling in, chat.
Say your name after the tone, and Google Voice will try to connect you.
Rajesh.
Dinner tonight. What the hell? Dinner tonight is stromboli with sausage, peppers, and onions. And some marinara to dip it in.
This is Big Waffin TV. How can I help you?
Yes, this is Rajesh.
How's it going, Rajesh?
Hello, sir. Yes, a recent call. I have. I don't know how to explain. I have a problem. I need help. I need good advice. Hold on. Let me get the accent down, chat. Give me a second. I need to get myself together, please. Hold on. We gotta get the accent. Chat. I have the accent down. India. Very good. Give me. I have problem. My problem is my bidet is not working properly. Yes. Hello. Yes. Sorry. I'm very nervous. Who is this? Is it Mr.
Completely confidential. This is completely. The only thing you can give me is your first name. We're anonymous. Everything's anonymous here.
This is redacted?
It's not redacted. This is not the CIA, my friend. Nobody knows your number. Nobody knows you but me.
Who are you?
I'm Big Waffen. This is Big Waffen TV.
Big Waffen. I have problem.
All right, what's your problem?
So you go into bathroom. When you take shit. After you take shit, you need to wipe ass. So I tried to wipe my ass, and when I wipe my ass, I use bidet. Do you know bidet?
Bidet's not for wiping. Bidet's for washing. But yes,
Well, I wash ass with my bidet after I take shit. Now my problem is Big Waffen.
Yes.
My bidet, I have little hose next to toilet.
Hose next to toilet. Got it.
Every time I spray into my ass,
Okay.
it is too powerful. So my question to you, Big Waffen, is what do I do?
Well, looks like you have to turn on the water pressure in there a little bit, my friend. It seems like it's a little bit too high.
Can
I
you
know for me,
can you come to my house and do this? Will you give good price? I have a lot of work. I have a lot of work if you need work.
Well, I
Give me
only have
good
4
give me
viewers
good
right
price
now,
on
but
this.
I have a couple gifted subs.
Gifted.
So I mean, I'm working here. I'm working
What
right
are you?
now.
What gifted sub? What are you talking about?
Frankly, I don't know. I'm new to this, but I'm true to this. Now listen, Rajesh, do you know how to turn down the water pressure in your house?
No, I need you to do that.
Where do you live?
Where? What?
Where do you live, Rajesh?
In a big house, probably bigger than yours.
You live in a big house bigger than mine, huh?
Probably. I have good job. I make a lot of money. I I drive a Tesla. What do you drive? What do you drive, Big Waffen?
Big Waffen drives a Volkswagen.
Volkswagen.
Oh, yeah.
Probably not even EV, huh? Yar, eh?
No,
Benchot, not even EV, huh?
Oh, Benchot, huh? Is that what you're gonna call me?
You know Benchot?
You're gonna call me a sister fucker.
You don't know Ben. No, you cannot know this. Who taught you this?
Oh, I know this. I
Who
have lots
teach
of
you
Indian
this?
friends. I have lots of Indian friends. Frankly, me and India, we get along very well.
Benchot.
I have lots of Indian friends. I have lots of Indian friends. Frankly, me and India, we get along very well.
Fucking shit, chat. That's too good doing the call-in show thing. Make sure everybody go follow Big Waffen. Let me give him a shout out.
908-336-1292. I am your host, Big Waffen.
Drop that man to follow. That goes on for a while, huh?
I got Bayern Munich pants in the mail. You know what I'm gonna do?
All right.
Costume.
That's cool. All right, back to where we were at. Solank.
Learning, speed, and accuracy in healthy volunteers.
Had to take a little break, you know?
Alleviated depression and anhedonia, which is loss of pleasure, in rats. Solank reduced alcohol consumption and withdrawal symptoms in rats. Solank increased BDNF levels in the hippocampus of rats. Solank modulated cytokine levels in healthy volunteers. So there is some evidence. A lot of this is in animal studies. I would love to hear more if anybody has experience with this or knows people in Russia who are taking this medication. There's not a lot of evidence in the Western world that this is effective. There's not a lot of studies like in the United States per se about this. I don't know. I don't know a ton about drug development in Russia. I don't know a ton about their process, how valid their clinical trials are, but I do think there are people in Russia who are using this medication. So what are some side effects, adverse reactions, or contraindications for Solank use? It's generally considered to be well tolerated and has no serious side effects or adverse reactions.
That's
the
good.
most common side effects reported are mild nasal irritation or congestion from the nasal spray, or local pain or redness from the injection.
See, and that's the reason why I kind of want to inject it. I would rather have just a little bit of redness rather than a congested nose. Dude, do you know how much congestion sucks? Not being able to breathe out of your nose, it'll ruin your whole day. Like, what the fuck? Like, if I was congested right now, I would not have streamed. You know, I could not stream if I was congested. That would fucking suck, dude.
These side effects are usually transient and subside within a few minutes or hours. Solank has no sedative or addictive properties and does not impair cognitive function or psychomotor performance. Solank has no known interactions with other drugs or supplements. However, Solank should be used with caution by people who have bleeding disorders or who are taking anticoagulants, also known as blood thinners.
I am neither of those things.
As it may increase the risk of bleeding, Solank should also be avoided by people who are allergic to any of its components. Solank should also be avoided by people who are allergic to any of its components or who have a history of severe...
Why didn't you edit that out?
...to other peptides or proteins. Okay, so overall, what are the positives of potential Solank use? It is natural and safe peptide that mimics the effects of a human peptide. It has multiple benefits for the brain and mental health, such as reducing anxiety.
Oh, let me just do something really quick before I forget. I wanted to watch a video on Reddit Treetide.
Improving memory, enhancing learning, alleviating depression, and managing alcohol withdrawal. It has no sedative or addictive effects and does not impair cognitive function or psychomotor performance. It has a rapid onset of action and a long-lasting effect, which is great. That's we're really looking for things like that these days. It can be administered easily as a nasal spray or an injection. So what are some of the negatives? Some of the negative aspects or disadvantages of using Solank are it is not widely available or approved in many countries outside of Russia or Ukraine. Again, I don't advise that you get this if you're not in any of those countries. This video is for educational purposes to learn about what is being used out there, what has potential, and maybe this may gain popularity in more Western countries and become available.
Oh, little did he know, bud. Little did he know. Damn, I want the Russian version, dude.
It is relatively expensive compared to other nootropics or anxiolytics. A lot of that is probably because it's pretty new. Approval in 2009. Only 14 years ago, not that long. Again, I don't know a lot about the drug development in Russia, but maybe it's still under patent. Maybe it's difficult to get or manufacture. I don't know. It may cause mild nasal irritation or congestion from the nasal spray or local pain or redness from the injection. It may increase the risk of bleeding in people who have bleeding disorders or who are taking anticoagulants. It may cause allergic reactions in some people who are sensitive to its components. So overall...
Those are the only negatives? I mean, obviously there's the whole unknown of peptides as a whole. That's one of the negatives. But that being said, those being the only negatives, all I see is positives.
Solonc is a synthetic peptide that has been shown to have various benefits for the brain and mental health. It is derived from a natural peptide called tufsin. Solonc mimics the effects of tufsin on the brain and nervous system, modulating the activity of various neurotransmitters, increasing BDNF levels, and affecting cytokine balance. Solonc has been studied for its effects on anxiety, depression, memory, learning, alcohol withdrawal, and other conditions. Solonc is generally well tolerated and has no serious side effects or adverse reactions. Solonc has no sedative or addictive properties and does not impair cognitive function or psychomotor performance. Solonc is widely used in Russia as a medication for anxiety disorders, but it is also considered a nootropic or a cognitive enhancer. Because of its effects on memory, learning, and mood, Solonc is not widely available or approved in many countries outside of Russia and Ukraine. Solonc is relatively expensive compared to other nootropics or anxiety.
Did he just repeat himself, or I think he just repeated himself? Yeah, this dude is like...
It does have some mild to moderate side effects such as irritation at the injection site or in the nose.
He's basically reading an essay. I get it. It's cool.
May also be contraindicated.
Good structure, brother.
In those who have bleeding disorders such as hemophilia, heavy periods, those kind of things. Overall, my take on Solonc is that it has potential. It is, approved in Russia and Ukraine, nowhere else. So I don't recommend you take this or even, seek it out unless you are in those countries. But it is something that really caught my attention because it is unique in the way that it works, kind of the way it's a natural boost to those neurotransmitters such as norepinephrine, serotonin, and dopamine. Really caught my attention because I personally really like SAMe, which is a medication that I talk about in another video, and it's something that I've taken for a while now, and it's been one of the most helpful things that I have taken for depression and anxiety. These things are always really interesting to learn about. Hopefully it's something that can catch on in the Western world, and there can be more studies here, and maybe it can be approved for use in European countries and the United States. Anyway, if you learned something, you enjoyed this video, please like it, subscribe.
Listen, I'm not saying, but I'm saying, like, Solonc sounds really good. C-Max sounds pretty good. Let's watch a video on just C-Max, see what's going on there. A clinical overview. Yeah, fuck it. Let's get it. Yeah.
Hello, clinicians. Today we're diving into a powerful peptide that's making waves in medicine, C-Max. Whether you're focused on cognitive enhancement, neuroprotection, or even pain...
I'm pretty sure he's AI. Let's see.
Pain management, this peptide has something unique to offer. Let's break it down so you can integrate it effectively into your clinical practice. C-Max has shown remarkable versatility and
yeah, he's AI. He's got to be AI. Hold on.
Clinical promise across a range of conditions. Here are its primary indications: cognitive enhancement and memory improvement, managing anxiety and depression, supporting recovery from ischemic stroke and brain injuries, assisting patients with ADHD, providing neuroprotection in neurodegenerative diseases, addressing optic nerve disorders.
This video sucks. It's AI. Not gonna fucking give it the view. No. This guy. Russian brain peptide. What is C-Max? The Russian brain peptide Americans can't get. Let's find out.
There's a peptide that's been used in Russia for over 30 years that most people in the USA don't even know exists. And it's on their list of essential medicines. It's been used to help stroke patients recover neurological function faster, improve cognitive performance in healthy people, and protect the brain from damage, all without the side effects you'd get from traditional stimulants. It's called C-Max, and today I'm going to break down exactly what it is, how it works, what the research...
Is he AI? No, he can't. I don't think this guy is AI. But you see that on the background there? That was in the back. This exact plaque. Like, I remember that exact fucking thing. It was in the background of the AI doctor we were just watching. That's
Actually
interesting.
Says, and whether it makes sense for you. Now, before we go any further, just a quick note. This is not medical advice, and I suggest that before you put anything into your body,
Oh, chat, this whole stream is not medical advice, and I suggest you talk to your doctor before you do anything that we're talking about in this stream.
you consult with the licensed physician. So let's start with what Samax actually is. It's a synthetic peptide made up of 7 amino acids that was developed in Russia back in 1982 at the Institute of Molecular Genetics. And it was originally created to help people recovering from strokes and brain injuries. Now here's what gets interesting. Samax is derived from a hormone your body already makes called ACTH, which stands for adrenocorticotropic hormone. ACTH is produced by your pituitary gland, and its main job is telling your adrenal glands to release cortisol. But Samax only uses a small fragment of that hormone, specifically amino acids 4 through 10. Because it's just that fragment, it doesn't have any effect on your cortisol levels. They also modified it with a specific amino acid sequence that makes it more stable and allows it to cross into your brain. So think of it like taking the governor off the version your body already makes. In Russia, Samax is actually a prescription medication, and it was added to their list of vital and essential drugs back in 2011. They prescribe it for stroke recovery, cognitive disorders, brain injuries, and even optic nerve problems. In the US, Samax isn't even FDA approved. It's been used as a prescription medication in Russia for over 30 years, and yet for some reason Americans still don't have access to it through normal health channels. All the human research we have comes from Russia. So that's what Samax is. Now, to understand how it works, you need to understand what's actually happening in your brain when you use it. And Samax affects several different systems. Let me walk you through each one. The first and most important thing Samax does is increase something called BDNF, which stands for brain-derived neurotropic factor. Think of BDNF like fertilizer for your brain cells, because it helps existing neurons survive, it helps new neurons grow, and it supports something called synaptic plasticity, which is basically just your brain's ability to form new connections and learn new things. Now, here's why that matters. When your BDNF levels are high, you learn faster, your memory works better, and your brain is more resilient to stress and damage. When your BDNF levels are low, that's associated with depression, cognitive decline, and neurodegenerative diseases. This is actually why exercise boosts cognitive function, because exercise actually increases BDNF. So what does Samax do to BDNF? Well, a single dose increased BDNF protein levels by about 40%, and it also increases the expression of the BDNF gene by about 3 times. It activates the receptor that BDNF binds to called TRKB, and the effects start within about 20 minutes. They peak around 90 minutes, and they last for about 20 to 24 hours. This is also why it was originally developed for stroke recovery, because after a stroke, your brain needs to rebuild connections and reroute functions, and BDNF is critical for that process. More BDNF means your brain is in a better state to learn, adapt, and recover. So that's BDNF. Now, here's where it gets interesting, because Samax also affects your dopamine system, but not the way you might expect.
Did he just say dopamine? Chat? Do love me that dopamine. Let's see.
By itself, Samax doesn't dramatically spike your dopamine levels. What it does is amplify the effects of other things that release dopamine.
Oh. So it's like a dopamine buff. It buffs the dopamine that you do get.
There's actually a 1995 study from the Institute of Molecular Genetics that showed when they gave Samax 20 minutes before amphetamine, the dopamine release was dramatically higher than
Must have had one hell of a time. That's all I'm saying.
amphetamine alone. Samax potentiates dopamine release, meaning it makes other compounds that influence dopamine even more effective. And this is exactly why some people report that caffeine works better when they're using Samax. Because it's not a stimulant itself, it just optimizes how your brain responds to stimulation. This also explains why users often describe feeling more interested in things without feeling wired or jittery. Samax also increases the turnover rate of serotonin, and this actually may explain some of the mood benefits that people report while using it, because better serotonin function is associated with mood stability and reduced anxiety. And then lastly, there's the neuroprotection side of things. Samax has anti-inflammatory effects in the brain and reduces pro-inflammatory cytokines. It has antioxidant properties that protect neurons from oxidative stress, and it also increases NGF, which is nerve growth factor, and that supports neuron survival and maintenance. This is the recovery and protection angle, and it makes sense why it was developed for stroke and brain injury patients. Because the brain is under much less oxidative stress and inflammation, which allows it to function and heal better. One more thing worth mentioning is that Samax appears to activate something called the default mode network, which is the part of your brain involved in creativity, visualization, and problem solving. Some users actually report enhanced visual thinking and creative flow. And while this is a less studied effect, it's definitely worth noting. So those are the mechanisms.
I wonder if it enhances visuals
now,
while
let's
like
look at
on
what the
LSD
actual
or
clinical
something.
Research shows. For stroke recovery, there's actually a 2018 study by Gusev and colleagues that looked at 110.
See, now this one is a really interesting peptide with all that it does and affects your brain. But then the other side of it, like it affecting your brain and your brain chemistry so much, like what if it's also doing some sort of negative effects, you know? Like it's not that much of a researched and regulated thing. That's what makes the peptides scary, man, especially these ones. But it sounds great, man. C-Max and Solank, baby. Let's get that stack going, chat. Stack, stack, stack.
Patients recovering from ischemic stroke. They were given 6,000
Clip that.
micrograms
I gotta
per
clip
day
that.
for 10 days, then a 20-day break, then another 10-day course. Plasma BDNF levels went up and stayed elevated through the entire study. Motor performance improved on standardized testing, and functional independence improved on the Barthel Index, which is the standard measurement for stroke recovery. They also did another study in 2001 with 30 patients in the acute phase of stroke, and Samax accelerated the rate at which neurological function returned, particularly motor function. And then for optic nerve disease, clinical data from Russian trials actually shows 70 to 80% therapeutic efficacy in vascular inflammatory and toxic nerve conditions, with improvements in visual acuity, visual field, and color vision. And then for cognitive enhancement in healthy people, there's actually a study they did in 2007 that looked at healthy men doing cognitive tasks. The group using Samax had 71% accuracy on memory tests, while the control group only had 41%. Now, here's what you need to understand about this research. All of it comes from Russia, and there are actually no published Western clinical trials as of right now. The sample sizes are smaller than what we typically see
For some reason, that makes me trust it more.
FDA approval, and while the research is promising, it's not the same level of evidence that we have for more established compounds. We're working with what we have. So I guess you're probably wondering who Samax might make sense for. Maybe someone looking for cognitive support without stimulant side effects, someone interested in neuroprotection and brain health optimization, someone recovering from brain injury or looking to support brain recovery, or someone who wants enhanced learning, memory, or focus during a specific period. But I do want to make sure that you know, if you're only sleeping 5 hours a night and eating garbage, Samax isn't going to fix your brain fog. This optimizes a system that's already working. It's not going to replace the basics. And I touch on this concept every single video we do. So if you're healthy and you try this, the effects are subtle. And it's not like a stimulant where you're going to feel dramatically different. It's more like things just work a little better. People notice improved verbal fluency, feeling more interested in things, and slightly sharper thinking.
And that's exactly what I'm looking for.
Some people describe it as if their brain was feeling younger or picking up new skills faster.
And that's even better.
Some notice benefits in the first few days, and for others, it can take up to a week or so of consistent use. Now, let me explain how it's used. Samax is primarily taken intranasally, either as a nasal spray or drops, and crosses the blood-brain barrier directly through the nasal passages.
Say drops, like eye drops? Or nasal drops? Or nasal drop, I guess.
You can also inject it subcutaneously for more precise dosing. But you can't take it orally because peptides break down in stomach acid. So you basically go through the nose or inject it systemically. For cognitive support, dosing is typically 200 to 600 micrograms per day, which is about 1 to 2 drops per nostril, depending upon the concentration of what you make. And you would do that once or twice daily. But keep in mind, you do need to cycle it. Samax works on BDNF pathways, and if you're constantly stimulating those pathways, they adapt and you get diminishing returns over time. The standard approach is typically 10 to 14 days off, then a break of several weeks to a few months. This isn't...
Okay, so it needs to be cycled. Interesting. Needs to be cycled on 14 days, off 1 month. Very interesting. All right, all right.
Something that you run year-round without breaks. And then lastly, you definitely want to make sure you take it early morning or early afternoon.
Yeah, Samax is the morning guy. Take in the morning. And then Solank is like the evening guy.
Because some people do report that it affects sleep if they take it too late in the day. Now, let me talk about safety. Samax has been used clinically in Russia for over 30 years with no major safety signals. It doesn't affect cortisol, it doesn't affect your hormonal system, it's not habit forming, and there are no withdrawal issues. What you might experience is nasal irritation with intranasal use, and that's expected. And some people get discoloration of the nasal cavity, and it's usually temporary. Headaches can happen, and those are often related to dehydration or going too high on the dose. And if you take it too late in the day, like I said, it can interfere with your sleep. Now, some less common side effects, but worth knowing, is that it can raise blood glucose in diabetics. You can also see an increase in blood pressure at higher doses, and some people report mood changes or irritability. Now, who should avoid it? Number 1, people on any type of MAO inhibitor. Number 2, people with uncontrolled hypertension. Number 3, anyone who's pregnant or breastfeeding. And number 4, anyone with any type of psychiatric condition, particularly mania or severe anxiety. My honest take on long-term safety is that it's not fully established by Western standards. But if you know me, you know that my instinct is to not trust the US government, and I'm a little bit of a conspiracy theorist in that regard. Russian clinical use for over 30 years suggests it's generally safe, but we don't have the depth of long-term controlled data to really make that conclusion. So if you make the decision that you're going to do research with Samax, it's definitely going to be investigatory, and you're probably not going to be able to get much support from the American medical system. So make sure that you're using your best judgment and not putting something into your body that's not safe. One last thing. I hope this video was valuable for you and you got the information that you needed to make the best decision for yourself. And if you want help staying up to date on peptide research, safety protocols, and where people are finding quality sources, there's a link to join my free school community in the description of this video. And inside that group...
Yeah, we're not going to join his free school community. Let's look at Retatrutide. Ah, Dr. Jones.
Everyone's asking
with the fresh video 2 days ago, my man.
Video, that's exactly what I'm going to show you. The absolute best peptides to add for incredible results. The exact order you use them in, what to avoid, because it's potentially a little dangerous out there. And there's one combination that the internet says that you should never ever do. That's producing the most consistent results that I've seen in our clinic. And it's actually not a big deal. I think people are overreacting there. I'm Dr. Jones, DC, and I've coached over thousands of patients through GLP-1 and peptide protocols. And this passion of mine comes from losing over 100 pounds myself using these same strategies. And now I work alongside our prescribing medical team, helping people do the same. Okay, so here's the problem with most stacking advice that you're gonna find online. It usually turns into a shopping list. Add this, add that, throw it all together. But your body doesn't lose fat through one pathway. there are three systems that have to work together: appetite control, fat mobilization so that we can burn it, and metabolic enhancement. You miss one of those, especially when you're insulin resistant in the background and inflamed, and it doesn't matter how strong your stack is, you're going to stall. That's the framework that we use with every single patient. Not what's the strongest thing to add, but which system are you missing so that we can optimize with strategic peptide stacking. So here's how this video is going to work. First, I'm going to show you retatrutide's biggest weakness that trips people up and why it explains your stall or why you're not seeing consistent reta results that everybody's talking about. Then I'm going to walk you through the 3 peptides that fill the gap in the right order to really catapult your results. And then after that, we're going to get into the forbidden combinations that the internet says you should never do. And then finally, what to stay away from. Okay, so let's get into it. So retatrutide, the first triple agonist, as you know, it reached phase 3 trials, meaning it works. It's super powerful, works on 3 hormone switches in the body at once. GLP-1, GIP, glucagon, I know you guys get it. Every approved GLP-1 on the market right now works on 1 or 2 of those hormone switches, and Reta is the only one that works on all 3. And that matters because of what glucagon does. Specifically, glucagon is one of your main release fat signals. It tells your liver to release stored energy, and it helps your body break down stored fat. Tirzepatide doesn't touch the glucagon receptor. Semaglutide doesn't touch it either, and it also doesn't touch the GIP. Tirzepatide's pretty badass, I want to make that clear. Retatrutide does all 3. This is why the TRIUMPH-4 trial results showed 28.7% total body weight loss at the highest dose, measured over 68 weeks. Those are staggering results. So on the fat mobilization side, system 2 in our framework, Reta is a beast. Nothing else in the GLP-1 class comes close to what that glucagon receptor activation does for actually getting fat out of storage. But that strength comes with the trade-off. And here's the part that very few people still understand. I do see some people talking about this. The fact is this: I've had so many patients come to us, they were on tirzepatide, they switched to Reta because they got super excited, and it didn't work. It didn't work for them. It's not that the medication failed them. I don't care how powerful retatrutide is, and it's powerful, more than tirzepatide. That doesn't supersede the fact that you got to be in a calorie deficit. And for a lot of people with retatrutide, they stopped being in a calorie.
That's the stupidest thing ever. Like, how can you even, like, listen, bro, I've been on tirzepatide for a month, and now I've been on semaglutide for like 2 weeks now. And like, my eating schedule is like, I basically fast for 2 days, and then I eat like a big, nice meal, and then I'll fast for like another 2 days pretty much. And I've been losing weight, you know, because I'm in a calorie deficit, obviously. I mean, I take vitamins and stuff too. You know, I take a multivitamin, a fish oil, fiber, and a couple other things, vitamin D and stuff like that. But yeah, like, how are people going to do this and not be in a calorie deficit? Like, I don't even know how you can not be in a calorie deficit while you're on these GLP-1s, because you literally don't want to eat. Like, bro, how fat can you fucking be that you're taking a GLP-1 and you're still hungry? That's fucking insane. Like, relax. You're shooting it up. You shouldn't be hungry. It literally makes you not hungry. Oy, oy, man.
Deficit because they weren't getting the kind of appetite suppression that they were getting from tirzepatide. And that's crucial. Calorie deficit over any powerful medication, always. It'll always be that way. There's nothing you can do about that. If you're in a surplus, you gain. If you're in a deficit, you lose. Now, I wish it was that simple. You guys know me for a while that I believe there's a lot more to energy balance and weight management, more than just calorie management, but that is one base piece of it. I don't negate that. Okay, so I think this little visual can help big time here. So like we said before, retatrutide, the GLP-1, the GIP, the glucagon. So we get a lot of fat mobilization, a good amount. But with appetite control, truthfully, it's somewhere in the middle. Some of you are getting good appetite suppression with retatrutide, but some of you aren't, and that's the big issue. Now, tirzepatide, appetite control is amazing. I mean, this is hands down the best appetite control. Cagrilintide is also a pretty powerful tool, but that one's not FDA approved. So we stick with FDA approved when we always have a good viable option, and that's tirzepatide. Now, fat mobilization is definitely better than semaglutide, but because tirzepatide does have that GIP, and there are GIP receptors on your fat cells, which helps, and it gives some amount of fatty mobilization that I have to say is better than semaglutide, which is non-existent because semaglutide is only GLP-1, but it doesn't have glucagon. And so this is, again, why, and we're going to talk about here in a bit, there's a little secret about putting these two together. Hint, hint, wink, wink. Well, more on that soon. So you've got this medication that's incredible at mobilizing fat, getting this stuff free, best in the class, but it leaves a gap in appetite control. System 1 has a hole in it. And if you're more hungry, it's easy to eat a little bit more without realizing it, and that calorie deficit shrinks or disappears. And that's where the stalls show up. So now I should mention that at higher doses, some patients in the trials experienced a weird symptom, dysesthesia, which is a tingling or numbness sensation reported in about 21% at the highest dose. That safety signal, a side effect that researchers are watching closely, showed up in phase 2 and is appearing at higher rates in phase 3. Work with your clinician on dosing, please. This is exactly why we start, when we do, patients on retatrutide at the lowest effective dose, and we stay on the lowest effective dose for as long as possible. This is not an FDA-approved medication yet, and it still should be treated cautiously. Now let's fill the biggest gap that retatrutide leaves behind. Real quick, if you're on retatrutide and this appetite gap is starting to click for you, the food chatter came back, so let's get into the 3 peptides that change everything when you stack them with retatrutide. And the order matters here, and I'll explain why by the end. Okay, first up, AOD9604. This is your system 2 amplifier, fat mobilization. Here's the concept. Retatrutide's glucagon activation is already pushing fat out of storage. AOD takes that even further. It's a small piece of the human growth hormone designed to emphasize fat mobilization. And in our experience,
Oh,
it doesn't
no,
come with the
no.
typical growth.
I don't fuck with anything that fucks with growth hormone. No, no, no. From HGH and does some shit. I'm taking notes out here, chat. Like, I'm taking big time notes. Like, look at this.
Hormone type baggage that most people worry about. In our patients, we haven't seen significant blood sugar issues or water retention at all. The focus with this peptide is pure fat mobilization. We want to get this stuff freed up so that you can burn it with your calorie deficit. What you need to understand about AOD, because this is where most people get it wrong, AOD's primary role is mobilizing, not burning. Burning fat is a separate step. Those are 2 different processes. Think of it this way. Your fat cells are like a locked vault, specifically when you're insulin resistant. It's a major lock keeping that vault shut. And AOD is one of the main keys that opens up that vault and puts the fat into your bloodstream so that your body can actually use it. But if you don't create a calorie deficit, if you don't give your body a reason to burn that fat, it'll go right back into storage. This is why the research on AOD didn't look too good, and why many doctors that rely only on research have a hard time understanding why AOD is so freaking powerful. This is why we pair AOD with structured therapeutic fasting. You mobilize the fat with the AOD, and you burn it during the fast. That combination is incredibly powerful, especially for patients with insulin resistance, PCOS, menopause, autoimmune condition.
How many is he gonna recommend to stack? Because stacking a lot on top of each other just to lose weight, and I mean, at least to me, it looks wild. That sounds wild. I'm taking notes on it regardless, so I know. But I'm not doing no weight loss stack, dude. If anything, I might just stick to the semaglutide because it's still working well for me right now. So I don't necessarily need to switch to Reta, but it's good to know about Reta and other things to stack with it, just in case maybe one day I do want to, you know, stack it and switch and stack. Or, you know, just give somebody else some advice, you know? It's interesting shit, man. Peptides are fascinating.
You might be thinking, I thought fasting was a challenging thing for people with those conditions, and it is for many people, not all. And AOD reduces that stress response that causes those individuals to potentially have issues with fasting to begin with. Are you seeing the synergy here? Hopefully you are. And this is the part that people miss. You see, if you're on a GLP-1 and you've got great appetite suppression, but the scale isn't moving, remember, appetite suppression isn't the same thing as fat burning, and it doesn't automatically mean that your medication isn't working. It might mean that your fat cells are locked. Insulin is blocking them. You're in a calorie deficit, but your body struggles to tap into the stored fat. So it starts to slow down your metabolism to compensate. You feel exhausted, your energy crashes, you stall. Does that sound familiar, anybody?
Imagine being in a situation where you're doing everything you can to lose weight, you're in a calorie deficit and everything, and you're not losing weight because your fat cells are locked. I don't know about that one, Dr. Jones. That sounds like bullshit to me, but continue.
You will get short-term fat loss. Don't get me wrong. The trials have proved that, but that's because your body relies on cortisol and stress hormones to override the lock that insulin resistance creates, and that's why you end up running into all these issues, and that eventually stops with a stall. Those are exactly the type of patients that we put on AOD. And what we observe in our patients over 3 to 4 months is that fat loss becomes consistent. The body seems to get more comfortable tapping into the fat stores, not just when fasting, but throughout the day. Now, with retatrutide specifically, you've already got the glucagon doing some of this fat mobilization work.
Glucagon
AOD amplifies this. So think of
glucagon.
as opening the vault halfway in AOD kicks the door wide so that we can just jam more through. Now, if you want me to do a complete video breaking down exactly how we dose and sequence AOD has the vault open. But what if the engine that's supposed to burn is mobilized? By upgrading your mitochondria from broken to burning. So AOD has the vault open. But what if the engine that's supposed to burn that fat is broken? Your mitochondria are your body's engines. They turn fat into energy.
Powerhouse of the cell, baby.
If your metabolism has taken a beating, years of insulin resistance, chronic inflammation, crash diets that just wrecked your metabolism, those engines are running on fumes. You can mobilize all that fat in the world, and it doesn't matter if your body can't burn it efficiently. You see, that's where Sloop 332 comes into play. This is an exercise mimetic, meaning it mimics some of the effects of exercise in the body. It turns on key and
SLUPP332, an exercise mimetic? No thank you, but that's fucking interesting. What the fuck? SLU. Let me show you guys my notes. Hold on. SLUPP332, an exercise mimetic. Very interesting. A fucking exercise mimetic?
Energy burning pathways that intense aerobic exercise actually does, but without the exercise. I call it marathon mode. What it does is turn up your mitochondria so that they burn more fat and produce more energy efficiently. It's essentially signaling your cells, act like you just ran 10 miles. And for patients who can't exercise, bad knees, chronic fatigue, recovering from surgery, this is a game changer. But it's not just for people who can't exercise. Even patients who are training hard will use Sloop during a metabolic reset phase because it does something exercise alone can't do. Mitochondrial uncoupling. It's basically your cells wasting more energy. It has to produce heat, and that burns up fuel, which burns up fat. Mitochondrial uncoupling means your cells burn energy less efficiently on purpose. That sounds bad, but it's actually incredible for stubborn fat loss. Your body wastes more energy as heat instead of storing it, and it's like taking your metabolism from super efficient at saving fuel to willing to burn more fuel. In our experience, patients on Sloop during a reset phase report cleaner fat loss, improved energy throughout the day, and better recovery. It's the metabolic tune-up that makes everything else work. Now, if this is starting to...
Sounds like you'd get warm while using it, like you'd heat up. I don't know about you, I run hot. I get hot, man. So, you know what I'm saying? Know what I'm saying, chat? Oi, oi, oi vey.
Concept. Let's shift gears. Sloop resets the engine, and once the engine is running clean, you need to pour fuel on the fire. That's the third peptide, and it comes in a form that's going to surprise you. The third peptide is O304. And this one's different for a reason that you're going to like. It comes
O304. Hold on, chat. Before we learn about O304 to add to the retatrutide stack, I'm going to go take a piss and get a sody pop. So, I'm going to leave y'all with these brief commercial messages.
Right now, the stream will be right back, okay? You can take it easy. Remain calm. It'll be okay. What's going to happen now is fun videos like this will play. If you're so inclined, this may also be a blinker checkpoint. Entirely up to you. But enjoy the rest of the break. Grubus will be back soon.
Want the best hot dog? I'm your guy. I have only the best glizzies, the best ingredients, the best bun. Nobody does it like me. And you can ask everyone.
Japan is one of my favorite places. It should be yours too. There's lots of great things about Japan. Ramen, anime. What else do you really need? Come to Japan and be cool like me. They love me here. It's pretty sweet, dude.
Hey, you want to know a secret? Watch the stream and you'll find some stuff out.
You're almost there, my friend. Just keep watching. That's all you need to do. Just keep watching. Keep on watching. That's all you need to do. Trust me, the secret will be revealed.
Are perhaps the most perfectly designed travelers on Earth. Look at this terrain. Sand, heat, wind. They move through it like it's nothing. Their feet spread out so they don't sink. That big soft pad on the bottom is like a built-in snowshoe for sand. They can close their nostrils against a storm, and those long lashes keep the grit out of their eyes.
As I've floated around here, I've had a lot of time to think. Think about this, think about that. I've thought just about every thought there is to think. You know what's the one thought that always sticks with me? Grubass is the best streamer I've ever seen. That makes me happy.
Whoa. Hey, what's happening?
After all the wars, this is what we were fighting for. Every mark, a memory. Faces of friends, cries of foes, all etched into the steel. And now, at last, peace to carry it into the light.
Your guess is as good as mine. I don't really know what's going on anymore. This might honestly be what makes the most sense.
Your wish has been granted. You are now watching the stream. We're going live soon, big dog. Don't you worry.
As a professional safari guy who's been doing big-time safari things for a long, long time, mate, there's one very, very important thing I've learned. Watching the stream is one of the best decisions you can make.
Let's make this quick. Wish me luck.
Don't worry, I've got this.
Geez, guys, you really need to watch the stream so I can avoid places like this. If you guys keep watching, subbing, and supporting this stream, I won't ever have to put the fries in the bag.
All right, chat, we're back. So, 0304 on the Reddit True Tide stack. Let's see.
The pill, no injection required. Now, I want to be clear, 0304 or ATX304 as it's sometimes called is technically not a peptide, it's a small molecule, but for all intents and purposes, we're going to put it in the same category for now. The reason why we use it is because it's an AMPK activator. So AMPK, or adenosine monophosphate kinase, is a protein inside your cells that acts as your body's metabolic master switch. And when it's activated, your body shifts from storing to burning energy. Think of it like flipping a light switch. In one position says store and another position says burn. 0304 flips that switch to burn. So all the downstream things that you don't think of that are happening during general fat loss, that's what you're turning on, despite even
0304 sounds pretty solid. I'm not gonna lie.
being in a calorie deficit. What it does inside your cells is improves how well your mitochondria works and how efficiently they process energy. It's like Sloop's cousin, but instead of resetting a damaged one, 0304 is pouring gasoline on a system that's already running. It accelerates what's already working. This isn't just theory. 0304 has phase 2 human trial data showing favorable metabolic markers and an encouraging safety profile. Now that matters because a lot of what you hear about the peptide space is preclinical animal studies, cell studies, but 0304 has been tested in humans. conditions. Now, here's the critical piece, and this is where most people mess up their stack. In our experience, 0304 isn't the best fit option during a calorie-restricted reset phase. If you're deep into fasting, running AOD, resetting your metabolism, we found 0304 can compete with that process. It's an accelerator, not a foundation tool. You use it after the reset is complete or after you've established some...
Interesting. Huh. Not to be used while currently fasting, as it can compete with body's natural fasting abilities. That's fucking wild. Okay.
Metabolic flexibility with AOD. It's your body composition finisher, the thing that takes you from good to great results. So here's the sequence, and this matters a lot. AOD first, mobilize the fat, open the vault, establish metabolic flexibility over the first 3 to 4 months. Sloop 332 during that reset phase, if you need a metabolic tune-up, stubborn cases, damaged metabolism, physical limitations. Then 0304 to accelerate once your foundation is set. Mobilize, reset, accelerate. In that order. Get that order wrong, start with 0304 when your metabolism is broken, or skip AOD when your fat cells are locked, and these peptides will work against each other instead of producing the favorable outcomes that we genuinely see.
Yeah, out of any of those, the only thing I would probably take is the 0304, but none of the other shit.
Our patients. Now, if you're on retatrutide, you now have a full picture for systems 2 and 3. Fat mobilization, metabolic enhancements, they're covered. But remember, system 1 still has a hole in it, appetite control. And this is where the whole stacking isn't a shopping list framework finally pays off. Now it's time for the combination that I've been teasing since the start of this video, the one the internet says you should never do. If you've spent any time on Reddit or GLP-1 forums, you've seen this.
Tirzepatide and retatrutide? Holy moly, bro. They're getting crazy with that one. Let me hear about it.
Retatrutide, it's redundant. 2 hammers for 1 nail. And that's the most common response that you'll see when someone asks about it. And guess what? They're wrong. Here's the mechanism. Low-dose retatrutide combined with low-dose tirzepatide is the combination producing the most consistent results in our clinic right now. And it's what our medical team prescribes in the right cases. Here's why it works. Retatrutide, Reta's superpower, is fat mobilization through the glucagon receptor, and its weakness is appetite and food chatter control. Tirzepatide is the opposite, and in our clinic, tirzepatide is the most effective GLP-1 that we've used for shutting down food chatter, like a hammer. For our patients, it's the gold standard for appetite control, but it doesn't touch the glucagon receptor, and it can't do what Reta can do for overall fat mobilization, especially if you have fatty liver disease. I really like the data that Reta has on fatty liver disease. So when you combine them at low doses, you're not using 2 hammers on 1 nail, you're using a hammer and a screwdriver. Different tools for different systems. So low-dose tirzepatide handles system 1, appetite control. Low-dose retatrutide, system 2. That's the fat mobilization and metabolic enhancement through the glucagon activation. You get the best of both worlds without the high-dose side effects that drove dropouts in the major trials. And that's the part that forums miss completely. The 2 hammers argument assumes that you're running both at full dose or moderately high doses. It's a lot, but you're not here. And at low doses, each medication is doing what it does best, and you reduce the nausea, the GI issues, the side effects that make people quit. Now, don't get me wrong here. If you are on retatrutide getting great results, don't have an issue with food chatter, you don't need to add TERS. There's no benefit. If you're on TERS getting great results, you want to get better results? Sure, add Reta. What we're talking about here is the solution to it.
I wonder how much weight I would lose if I stacked it. Oh my god, if I took retatrutide and tirzepatide at the same time, I'd fucking turn into a twig in 2 months. That would be amazing. Holy shit, dude.
Ensure that you don't get started
stacking retatrutide and tirzepatide. What a madman decision, chat. It's tempting. It's tempting.
With Reta and find out that it's not good enough, that you get both. And you
it's
get
not really tempting. I just said that for the clip.
Results. Now, the results that we're getting with this combination, and I'm talking real patients, not theory here, are better appetite control, more consistent fat loss, fewer side effects, and patients actually staying on the protocol long enough to see it through. That's the whole game here. The best protocol in the world doesn't work if you can't tolerate it. Now, I want to be clear here. This is not something that you eyeball from a forum post. The dosing on this is precise. It requires blood work, it requires monitoring, and it requires someone who understands how these 2 medications interact at different doses. This is exactly the kind of combination where professional medical supervision, it isn't optional. It's the whole point. And honestly, I think anybody taking retatrutide should be getting medical guidance because this is not an FDA-approved medication. Now, some people would say that should be the case for any medication, but I will comfortably say that people doing tirzepatide on their own because they have to, I'm not going to make you feel bad. I'm not going to scare you and say, oh, tirzepatide without
Yeah,
medical
don't scare
intervention if
me,
you don't know what the hell
Dr.
you're doing.
Jones.
Sometimes you got to do what you got to do because you don't have the option, whether it's finances or something else. But retatrutide, we can't treat it the same as tirzepatide. We still don't have a lot of understanding as we do because it hasn't finished phase 3. There are real concerns that I have with retatrutide for specific medical conditions like elevated heart rates and arrhythmias and things of that nature. Now, if you want me to do a full video, head-to-head breakdown of retatrutide versus tirzepatide, the side effects, the weight loss, the appetite control, and how we think are just genuinely dangerous. And this next part could save you a lot of pain and setbacks if you know what to avoid. The two combinations that I want to touch on briefly that I keep seeing on forums that genuinely concern me, and one sourcing mistake that could waste your money entirely, or worse. Okay, so first up, phentermine stacked with retatrutide. Phentermine is a stimulant. Retatrutide already causes mild dose-dependent heart rate increases, 2 to 4 beats or more above baseline. Now, GLP-1s as a class do cause this, but retatrutide causes significantly more relative to semaglutide and tirzepatide. You add a stimulant on top of that, and you're creating extra stress on your heart and blood vessels. Your heart is working harder from 2 different directions at once. We don't run this combination in our clinic, and it's not one that my medical team would ever recommend. Second, high-dose Yohimbe with any GLP-1. Yohimbine at high doses can significantly spike your heart rate and blood pressure. Stack that with Reta's heart rate elevation, and you're in dangerous territory potentially. If you're using Yohimbine, it needs to be carefully dosed and monitored, not something that you eyeball.
What the fuck is Yohimbine?
Now, moving on to sourcing. If you choose to go the research peptide route, I'm not here to judge you, but I do want you to be smart about this. Retatrutide is a single complex chain peptide conjugate. That's a sophisticated molecule, right? Standard lab testing like HPLC and mass spec.
Dr. Jones, the Chinese are sophisticated people. I trust them to formulate that sophisticated compound.
Can confirm molecular weight, basically the size of the molecule, but it can't confirm the amino acids, the building blocks, are in the correct order. Now, the FDA has documented seizures of products containing heavy metals, endotoxins, which are bacterial released toxins, and the wrong peptide sequences. That's not from every supplier, but it's enough to take quality seriously. Third-party testing, certificate of analysis, and supplier reputation matters tremendously. And this is really the bigger point here. Whether it's choosing the right
Why don't you
peptides,
start
sequencing
selling
them
shit,
correctly,
Dr. Jones?
combining
I would
Reta with
trust
hers at
I
the
would
right
trust
doses,
you
or
as a
verifying what
source.
you're
Like,
putting
come
in your
on, you
body.
could make
The
so
number
much
of
money.
variables is what makes this hard to do alone. It's not any single decision. It's the interaction between all of them, changing as your body changes week to week. That's what a good coach can track for you. Now, before I wrap this up, if you've been researching stacks on Reddit and you're feeling overwhelmed by conflicting advice, you're not alone.
All right. How about where do you get quality peptides? Like, where to get peptides? Yeah, like I know I'm getting ads now from like a million different fucking peptide websites. Like we have Teammates. No, I would never buy peptides from a company called Teammates. That's honestly corny, bro. That's corny as shit. But what do they got? NAD plus. What do they got for weight loss? They got the Reta, compounded tirzepatide. You got Zepbound? What? Can I just buy it? $99 a month? No way. What? Oh, clinical service only. Includes clinical eval and prescription management. What is this? No. No. I'm not falling for it. Alright, chat. How to get started with peptides, what they are, history, and what they do. No, we already learned that. How to find the right peptides to reach your 2 years ago now. Peptide sourcing, how to choose a quality peptide supplier in the USA. That's good, but that's 9 months ago. Does Dr. Alex say where to get, or Dr. Jones say where to get peptides? Sourcing. Two years ago. This guide, does the guide say where to get it? Nope. Not what I'm looking for, Dr. Alex. Dr. Jones. Dr. Alex Jones. Hey, that's me, chat. Sourcing peptides. Alright, fuck it. Let's watch this guy's video. The truth about where your peptides actually come from. Because it's the latest video. 2 months ago. And this guy's other videos... This guy is legit. I trust his word so far. I have no reason not to.
I don't want Chinese peptides.
Why not?
All right, I hear this from guys every week.
Oh, okay.
And you want quality. You want safety. You want
exactly.
to know what you're actually...
It's all about just finding the right the right Chinese peptides. You need the right Chinaman in your life. That's all anybody ever needs in their life. If you have the right Chinaman, life is so much easier. That's it. Just find you a Chinaman. I need me a good Chinaman.
Actually putting in your body. So you go out and you find a company that says US GMP manufactured, and you pay the premium because you think you're getting something better. But here's the pattern I keep seeing. People are paying twice as much for a vial they think was made in America when it came from the same exact place as the...
Can this stuff actually be made in America? Like, is that legal? Is there US manufacturers? I don't know.
Cheaper vial they were trying to avoid. And nobody's talking about this because the companies benefiting from this confusion have no incentive to tell you the truth. So, in this video, I'm going to show you exactly where peptides actually come from, who's really making them, and why the way people are trying to solve this problem is actually making things worse for everyone. But before I can
no
do
way,
that, I need to give you
no way does YouTube have a fucking quality setting blocked to YouTube Premium. They got 1080p Premium, which has enhanced bitrate.
Context.
That's
because
interesting.
If you don't understand
Damn,
how
YouTube.
this industry actually works, none of this is going to make any sense to you.
Josh Holyfield. Peptides Master.
So look, I've been in the gray market peptide and anabolic space since around 2002.
Oh, so he knows all the plugs.
The way we got the
I trust this guy.
Get here was by sending a Western Union to a random guy in China and having absolutely no idea where it came from or if it was even going to show up. You'd send your money, and then 3 to 5 weeks later,
Motherfucker's been on peptides for 20 years.
DHL or some random
Chat, I
courier,
trust his word
and
over
you have
everybody.
No idea if you actually got what you paid for. There were no COAs, there was no third-party testing, there was no customer service. You wired money to a stranger, and you hoped for the best. So when I see people today who are discovering peptides for the first time, demanding pharmaceutical-grade reassurance, while expecting to pay Chinese gray market prices and complaining that they can't verify
That's me.
purity to their satisfaction,
I want pharmaceutical reassurance while paying gray market prices. That's me.
I have to be honest with you. That expectation is delusional. And I get it. You didn't know. Nobody explained this to you. And by me making this video, I'm actually blowing the lid on an entire industry that is out to get your money and taking advantage of you. So let me show you how this industry actually works and why the current approach is destroying the very thing people are trying to protect. So let's start with the basics of how peptides are actually made. Peptides are chains of amino acids that get built one at a time through a process called solid-phase peptide synthesis. Each amino acid gets attached to a resin, protected, washed, and then one is
got
added.
to point to his whole
And you
point.
repeat that cycle for every single amino acid. Then the peptide gets cleaved from the resin and purified through a process called HPLC. Now, Here's why this matters. This isn't like testosterone or anabolic steroids where you can buy raw powder from China and brew it in your garage. Plenty of guys have done exactly that for decades with testosterone. Peptides are completely different. You can't make these in your basement. The barrier to entry is extremely high because the equipment alone costs hundreds of thousands of dollars, and it requires sterile laboratory conditions and trained chemists to operate. People are not making peptides in their garage, and even the facilities that can do this still need raw materials, protected amino acids, resins, coupling reagents, solvents, and those raw materials come from somewhere. China produces 80% of the global generic API supply, which means that every peptide manufacturer on
Yeah, that's something a lot of people don't realize is China is a huge pharmaceutical manufacturer, especially for a lot of drugs that are sold and fucking distributed in the United States. So, boom.
Earth is dependent on...
Comes back to my point about the Chinaman. You need a Chinaman. The Chinaman knows what they're doing, man.
Chinese chemical supply chains for their building blocks. So even if final synthesis happens in the United States, the raw materials trace back to the same source. So now that you understand how peptides are made, let me show you who's actually making them in the United States. There are about 5 facilities in the entire country that manufacture peptides at scale. You have Corden Pharma in Boulder, Colorado, with about 300 employees and 10,000 liters of reactor capacity. You have AmbioPharm, which operates facilities in both South Carolina and Shanghai. You have CPC Scientific, which is primarily based in Hangzhou, China, and is building a California facility that won't even be operational until 2026. You have SK Pharmteco in California, which is also coming online in 2026. And you have Baychem and Cambrex doing pharmaceutical API production. Now, here's the key. These facilities are contracted to pharmaceutical companies. They produce peptides for FDA-approved drugs and clinical trials worth millions of dollars. They serve compounding pharmacy distributors like PCCA, and their production is scheduled months in advance through multi-million-dollar contracts. These facilities are not fielding orders for 500 vials from ResearchPeptidesUSA.com because US GMP production costs hundreds to thousands of dollars per gram. So if a company is selling you a 10 milligram vial for $50 and still making profit, that vial did not come from a US GMP facility because the economics are impossible and the mass supply does not add up. So if there are only 5 facilities and none of them are selling to research peptide websites, then where are these companies getting their peptides?
China.
Chinese manufacturers offer OEM and ODM services where you can buy bulk peptide and get custom branding with your label on the vial.
What's ODM? I've never heard that before. ODM manufacturing term. Original design manufacturer. A company that both designs and Oh, okay. Interesting.
Some platforms have 0 minimum orders, and there are over 190 peptides available for private labeling.
Hey.
This is not a secret. You can actually find these services on Alibaba.
Maybe I should private label my own peptides. Think about it. Once I become a big streamer, I start selling my own line of peptides to you guys. We call it Grubas peptides or Grubanotides, something like that, and I'll have the best peptides in the game. Just a vial with my face on it, and you take out the peptides and you shoot up. You know, it'll be great. It'll be fucking great, chat. Holy moly!
MadeInChina.com right now. So when a company claims that their peptides are made in the USA, what they actually mean is one of 4 things. Number 1.
My heart's fine.
I need to get ad blocker, don't I?
Ignoring your heart health risk is no way to go through the world. Take Bayer's 2-minute assessment at seeyourrisks.com to understand your heart health risk factors.
I think I do, chat.
That's the sound of an American oil company hard at work. Want to be a part of it? Listen up.
Hello, my name is Adam Ferrari, and I'm the CEO of Phoenix Energy.
I look forward to you joining us at our next webinar where you can drill deeper into our body.
Bro,
we currently
I'm just trying to drill
Either
into
they're
some
just outright
peptides.
lying and rebranding Chinese product, which is most of them. Or number two, a U.S. address receives shipments from China, aliquots them into vials.
All right, I get it. I get it.
just need
It's
to
all
find companies with
Chinese.
third-party testing and COAs because that's how I verify.
Yeah, I know what a COA is already
in the
too.
first place. Initially, COAs were used to verify suppliers for the research companies themselves.
content,
This was
can't have
business-to-business verification where
All right, I get it. The market's sketchy, yes, as is anything when you go and get stuff from China. But who has the good stuff? That's what I'm trying to... That's all I need to know, dude. Who's got the good shit? You're all talking about the peptides. Where do I get the peptides? Do you sell the peptides, Josh Holyfield? Do you have... Oh, reliable peptides and GLP-1s. Shop now. Uh-oh. ZestyRatResearch.com? Bro, are you kidding me? ZestyRatResearch.com, bro? If I'm gonna buy sketchy fucking Chinese peptides, it's not gonna be from a website called ZestyRatResearch.com. Get the fuck out of here. What? You could come up with a better name than that, dude. What do they have at least? Look at the fucking... It's... Stupid. Stupid, 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 dude. How do you even come up with that? ZestyRatResearch.com. Look at these fucking things. CJC1295 DAC, epithalin, Fox dye, chat. It's Fox dye. We're gonna inject ourselves with nanomachines. Alright, what about Retta? I got that Retta. GLP-3RT. So, okay. So, like, what's pricing look like? I'm just using this as a reference. So, like, 10 milligrams. That's $80. 20 milligrams. Okay, so how much is a single dose? Right? Like, how many mg is a dose of Retta? Yeah, Google's not going to tell me. Okay, cool. Here's all I have to do to find out. Just add the word Reddit. There you go. This guy does 8 milligrams a week, split into 4 doses, done to mitigate side effects I got from it. Huh. That makes sense. Taking like a smaller dose. Okay. I feel it works the same as 1 weekly dose. This guy's taking 8. This guy does 3 a week. This guy does 2.5 a week. I think my Ozempic is 5. Yeah, it's 5. This guy does 2. I think because I mean at that pricing, like I'm not buying it from fucking Zesty Rat Research, but I'm guessing this is the average price. So at that pricing, 10 milligrams for, okay, I'd be pretty much spending the same amount as I would be spending on retail Ozempic than I would on this. Because with the insurance and all that, right now I'm like $200 a month for the auto-injectors of Ozempic. Meanwhile, for this, I would probably get 20 milligrams a month, because I think 5 milligrams a week sounds pretty good from what I read there, you know? That sounds like a decent average to start with, at least, because I take 5 of semaglutide right now, and other people have been taking 2, 7, 8, 10, 5, so 5. 5, okay. Let me put that in my notes. Average dose. Gotcha. Alright. This guy was only doing 2 a week. 2 MIGs. And he saw side effects. Interesting. Retta has a half-life of 6 days, so dosing every 6 days or so, or every 3 days makes sense. Okay. I've titrated up to 7 a week. I take 1 each night before bed. That's interesting. 1 each night before bed. I mean, yeah, like, how much of a dose is... How do you do it if you're micro-dosing it, you know? Like... Microdosing, Retatrutide, Reddit. Microdosing it for inflammation. My doctor suggests a tiny microdose of tirzepatide to see if I can help my inflammation. Has anyone tried this? I had a great diet and exercise, not overweight. Huh. I've been on Wegovy and it has been great for me and my pain and cramps. It's a bit expensive. Yep. 6 weeks and my pain is pretty much gone. That's really interesting. People taking it for pain. Let's turn this down a bit. You know what I kind of want? Relaxing Zelda music? That could be cool. Yeah, that's alright. So yeah, microdosing the GLPs. I'm on Zepbound for weight loss and my endometriosis systems disappeared. I lost the weight I wanted to lose and I'm actually talking to my doctor about staying on a smaller dose for inflammation. Went out for a month and medicine abroad with me broke. What about Retatrutide? Here we go. Microdosing versus weekly. Okay, so I read many articles and posts. Somehow can't find what he's looking for. This for guys, Sema. Getting engaged. He's at the heaviest he's been. Tracked all his blood sugars. He's just seeing, would he see better short-term results with microdosing or weekly pinning? I guess that's the hot debated thing in the glutide community. Been on Reddit for about a year. Currently cruising at 12 milligrams a week. Damn. I switched from Sema and started Retta at 2 milligrams a week. Held that for the usual 4 weeks and had no sides. So I started moving up rapidly, holding only when feeling bad. For me, Retta really didn't start to work until 5 milligrams. However, the satiety, is that how I want to say satiety so bad, like for some reason. The satiety didn't show up until 8 milligrams. Semaglutide provided suppression, but Retatrutide brings satiety. Which I consider superior. I get hungry, enjoy food, but I'm satisfied after a few bites. I eat whatever the hell I want, just end up not eating a lot of it. People who are used to the appetite suppression of Sema and Terz have the crap scared out of them by Retta because the suppression is usually less. But at higher Retta doses, the satiety shows up and makes Retta king. I wish more people understood this difference. Yeah. Yeah, because Retatrutide, it's... So, like... I'm really thinking about dropping Ozempic and just going straight Retatrutide. And then Semax and Salank. I like that. I like the sound of that. Imagine a fucking Retatrutide and Tirzepatide stack. That would be insane, dude. dihexan, synapsin. Nah, I ain't gonna do any of that shit. I don't need none of that, dude. None of that. I'm not gonna go crazy with the peptides. Just a couple. Just starting with Semax and Slank. That would be good, honestly. Now it's just a question of where do I find good peptides. Josh Holyfield, not buying it from Zesty Rat Research. Absolutely wild name, sir. Wild name. Alex Tatum, do you sell fucking peptides? Got a Discord. Let's see. Actually, fuck his Discord. Maybe he's got a video on it. Zen before the gym. Here's what it does to your gains. Great fucking video titles. Trenbolone, the most powerful steroid ever created. Ah, that's one to watch later for sure. Yeah, I'm subscribed. I gotta subscribe to Dr. Jones too. Dr. Jones is good. Who's like the biggest does Clavicular sell his fucking peptides? Where is this guy at? Is this him? Clavicular one-to-one workshop. Of course he's got a fucking workshop. Yeah, he's gonna tell you where to get his peptides if you join his workshop. That's crazy, bro. How much is it? Ain't no fucking way I'm gonna actually sign up. But, like... I just want to know where to get the good peptides, dude. Where do we do it? This fucking school thing is $50 a month. Holy moly. That's insane. Whatever, I'll find out where to get them off stream. Chat, if I find out, I'll share the info with you. Let's read some more about Retatrutide here. Is there anything else I want to know about peptides? Not really. I mean... just where to fucking get them? Well, alright, chat. You know what? Honestly, I think we did some good due diligence today. We learned a lot about peptides and where to get them and all that. So, I'm gonna end the stream. This is the end of the peptide stream. I'm gonna be back later in like a couple hours. You know, I'm gonna get some eats and shit, and then gonna stream some Marathon later. Yeah.